Hello, hello. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. It is Sunday, July 21st. This is the second of our 2 monthly scheduled meetings, support group meetings for interstitial cystitis, chronic prostatitis, bladder pain, pelvic pain, overactive bladder, vulvodynia, you name it. If you've got pelvic pain, we are the people to give you the support that you richly deserve. Oh my God. I'm having a morning. I am having a morning. Hello, Sherry. How are you, hon? Hello, Donna. Nice to see you. Oh, I don't know about you guys, but I had a long night last night. It took me a while to get started this morning. Yes, it did. Yes, it did. Hi, Carolyn. Hi, Kareen. It's very nice to see you guys this morning. Hope you guys are having a good Sunday. I hope for any of you stuck in the heat, I hope it's not too bad. I hope that you're doing okay. You're staying cool. Got to remember, guys, that any exposure to extreme temperature is going to trigger a stress response. And what that means to the bladder is that it could give you a flare. It doesn't matter if it's intense heat or intense cold. Your body reacts to that. And it can cause muscles to tighten. It can cause nerves to release irritating neurotransmitters. Stress, whether it is physical, mental, or emotional, can certainly exacerbate our symptoms. However, I'm going to say right now, anybody who has the audacity to say to you that your IC is caused by stress, that's the original cause, it's just, they can shove it up. You know what? I'm a little spicy today, guys. I'm a little spicy. I'm going to apologize in advance if I am a little bit spicy, but hey, man, it happens. It happens. Hello, Edith from Houston. It's nice to see you. Hi, Sherry. Nice to see you. All right. So for those of you who know, who've been here before, I'm having a weird day, guys. I'm having a weird hair day. I'm having a weird makeup day. I'm just weird today. Didn't eat breakfast. Didn't really get a chance to eat breakfast. So I'm going to blame it on that. So we have a lot to do today. We have a lot to do today, and we're gonna do some reveals here. So for those of you who are new, the IC Network support group meetings are all about making you so strong, so knowledgeable, and so informed that nobody can ever mess with you again. I want you to be able to walk into your doctor's office informed, assertive, empowered, and ready to engage in really good productive discussions about your medical care. Now, one of the things that I routinely say over and over and over again, and I said it yet again, I did a really nice coaching yesterday for a couple of hours with a young man who has IC, is I don't want you to walk into any doctor's office and say you've got IC. Don't say that, because we are in a situation where if that doctor is an older doctor, he was taught that IC, he or she were taught that IC was potentially all in your head. So we don't want to walk into that landmine. But we also don't want to walk into any pre-existing beliefs. You know, that there are some doctors who believe that IC is quote unquote curable and incurable bladder disease. We certainly know that that's no longer true. We do subtyping. We know that some subtypes of IC have the potential of being cured. And so instead, I want you to focus on your symptoms. I want you to focus on your symptoms. So if, for example, like I have been working with for several years now, a man who has pain in one specific location on the left side, just to the left side of his bladder. And every single time, that's what he points to. It's at this point. And he's like, is this IC? Is this IC? Is this IC? And I went, what makes you unique as a quote unquote IC patient is that you can point to a spot Most IC patients cannot point to a spot. Most IC patients, if I stand up here, let me back up. Okay. So here is the top of my legs, right? So we're looking at this triangle here. This triangle of your pelvis from hip to hip down to your crotch. So this triangle. And most pelvic pain patients are not going to be able to focus on a spot. Your pain is going to be basically in this area, right? But if you have pain here, or you have pain here, or you have pain here, right below your belly button, then we're actually going to be looking at other things also. Okay. And so in his case, what makes his case so interesting is the first time I talked with him, it's like, it's the spot. Every time it's the spot. What is the spot? And I said, I don't know. That's what we got to figure out is what the hell is the spot? We need a doctor to look in your bladder at that spot and see if there's a lesion there. So they did that. There was no lesion there. So it's like, okay, well, what the hell is the spot? Well, to make a very long story short, multiple surgeries later, what they were able to determine in his case is that he had a seminal vesicle that had developed gangrene. So was he an IC patient? Absolutely not. No, absolutely not. It all went back to him to an early procedure that they did for chronic prostatitis years and years ago that somehow blocked a duct and left bacteria in there. And all of his pain was related to this one tiny duct that when they got in there correctly, surgically, was black and basically powder by that point in time. Massive, a little tiny area of gangrene. Okay. Now, would interstitial cystitis treatments help him? Absolutely not. No. Okay, let's look at another situation. Let's look at that patient. Let's see. Gosh, I was working with a really interesting patient. What was that? It was on Friday. Okay, so in her case, she had quote unquote all the symptoms of IC. Okay, the frequency, urgency, pressure, pain. But it was very, very consistent, right? Consistent over 24-hour period, constant pain. And so as we're kind of talking about it, trying to figure out what this is, we know she had very, very tight muscles. It's like, okay, did you have your muscles checked? Yes. Are they tight? Yes. Did you do your physical therapy? Yes. Did you stop your physical therapy? Yes. Why? Because I couldn't afford it. And then she went back to bladder therapies. And it's like, no, honey, a bladder therapy is not going to fix a tight muscle. A bladder therapy is not going to fix a tight muscle. And, she kind of forgot that. She just forgot that. So we're talking about it and we're really trying to figure out, well, what happened to your muscles in the first place? Was there anything interesting or weird that happened to your muscles? And she shared that 5 or 10 years ago, probably about 10 years ago, her uterus had detached and had flopped over on her bladder. It's like, okay, that's really rare. So they went in and they did a hysterectomy and they removed her uterus and then they tacked up her bladder. And her surgery started, her quote unquote IC symptoms started immediately after that surgery. It's like, okay. So let's think about that for a moment. What could have happened during that surgery that could have changed your muscle so much that you're now dealing with long-term constant pelvic tension, which is now affecting your bladder? And ultimately, in the end, again, in her case, bladder therapies wouldn't have made any difference because it all came back to this pelvic floor trauma tension from this surgery. Let's see if I can think of a couple of other examples of people. If you have pain, so like here's my hip bone, right? Okay, I apologize for my menopause tush. Never had that before. If you can push in right here or on the other side, right here, whoops, and feel pain, that is your pelvic floor. That is not your bladder. That is your pelvic floor. That says that you have tight pelvic floor muscles. So again, if you're not getting better on bladder therapies, when you go to the doctor, take a step back and say, okay, doctor, here's my symptom. Can you help me understand what in my pelvis could trigger that symptom? Another thing that's important is you've got to differentiate between internal pain and external pain. It amazes me the number of patients who simply can't do that very well. If your pain is on the inside of your body, you should not be able to touch it with your finger unless it's vaginal pain. If your pain is on the outside of your body, on your vulva, on your testicles, at the tip of your penis, if you can touch it with your finger, that is external pain. Anytime we're looking at quote unquote bladder wall vulvar pain, we're looking at the quality and health of the skin on the vulva. Does that patient have estrogen atrophy? Does that patient have chemical irritation? Things like that. The American Urology Association guidelines for IC are really clear. What they say is if a patient is not responding to therapy, if a patient is getting worse over time rather than better over time, then it is important that we take a step back, revisit the diagnosis, try to understand this patient's anatomy. Let's make sure we haven't missed something. Let's make sure we haven't missed something. If you've tried every bladder therapy in the book and you're not getting better or you're getting worse, that is when you take a step back and go, okay, what are some of the other things that might contribute to this? Any good IC clinic now, we do at your very first appointment, they're going to do a urinalysis. And of course, we now have lots of debates about the effectiveness of urinalysis, but they'll do a urinalysis. They'll test you for every sexually transmitted disease is known to man, even if you are a virgin, even if you haven't had sex in a decade, they're still going to do it out of an abundance of caution. They're going to check your pelvic floor. And again, we're trying to study your anatomy. We want to try to figure out what it is in your pelvis that could be triggering your symptoms. If, for example, you have painful periods, if, for example, you have heavy bleeding, that is really important to say to your doctor because what that suggests is you might have endometriosis. Endometriosis can affect the bladder. If you have a heaviness, a fullness, if you have a downward sensation, an upward sensation, we're going to look at your pelvic floor, maybe a pelvic floor prolapse. If you have positional symptoms, you're fine when you stand, but when you sit down, when you bend over, we're going to look for nerve entrapments. If you have I call it a dirty secret of IC, one of the dirty secrets of IC, and it's not really, it's a mistaken impression that it's dirty, okay? But because IC patients and we are often uncomfortable telling our doctors certain things, if you ever have persistent genital arousal disorder, this feeling of being slightly aroused, but it's painful. It's like, what the hell? Whoa. What is this? I don't like this, right? You get this kind of, it's like, okay, man, this is painful. I'm not aroused in any way. I mean, I know there's no reason for this. That actually implies that you might have irritation of your pudendal nerve, which is very, very interesting. And we can test that out with a nerve block. Because some of you out there have been rocking around for days, months, or years with nerve pain, and you have no clue, and you're too embarrassed to tell your doctor about it. Well, come on, break the embarrassment. It's kind of like I have rectal pain every now and then. I call it rectodynia. I'm a vulvodynia patient, and my rectum gets a bit more sensitive. It gets sensitive because I have levator ani syndrome. My levator muscles get super tight sometimes. But I also have a little tiny internal hemorrhoid, like right on a freaking nerve. Like seriously, right on a nerve. Little tiny, tiny thing, right? And my primary care provider at the time was this adorable, hunky young man, 20 years younger than me. He was so handsome and so sweet. And I just couldn't talk to him about it. I couldn't. So whenever I was having a flare with my hemorrhoid, I would go to urgent care, and I'd specifically ask for a woman doctor. And then and that was going on for a couple of years. And then finally, one day at an appointment with him, I said, one day I'm going to talk to you about this hemorrhoid thing. And he goes, Jill, I have Crohn's disease. I can talk about anything related to the bowel because I live it every single day. You are absolutely welcome to talk to me about it. And I was like, oh. And then I talked to him about it, and he helped me tremendously. So don't let embarrassment stop you either. Okay. Hello, Edith from Houston. Hi, Melissa. Hi, Brenda. Hi, Lilina or Lilena. I hope I don't pronounce it correctly. Hi, Linda. Hello, David. Leanne. David says, I take a laxative sometimes for constipation and it works, but it makes my IC prostatitis 10 times worse. Do you think the laxative is a problem? It's a stimulant called Dulcolax. So stimulant laxatives trigger spasms. And when you trigger spasms, you're triggering the bowel to spasm, but you could potentially also be triggering the smooth muscle of the bladder to spasm. Plus, you can become dependent on it. We don't want you to become dependent on a laxative. It is better to approach constipation with fiber. If you've got what I call hard marble stools, where you feel like you're passing hard marbles, that means that number one, you're not drinking enough water, and number two, you're not eating enough fiber. To have normal, healthy bowel movements, you should be eating 20. For women, you should be eating 20 to 25 grams of fiber. For men, 25 to 30 grams of fiber a day. And so, David, what I would encourage you to do is look at the fiber content of the things that you're eating and try to get yourself up to a higher fiber level. One serving of green peas, one serving of beans can give you 13 to 16 grams of fiber a day. Whereas some people mistakenly eat a lot of salad thinking, hey, I'm going to get a lot of fiber from my salad. And you don't get fiber from salad. You get 1 gram of fiber for one serving of lettuce. That's not enough. One serving of green peas, 13 grams of fiber. And so, and the other thing, David, that you could look at is you could look at acacia fiber, or you could look at, and here's, hold on a sec. I gotta say, I worked in my garden yesterday for 4 hours. See, look at this. I have to sit on this pad because my glutes, I gotta sit on this. I totally traumatized my glute muscles. Like, holy hell, was I sore last night. That's when you whip out a little tiny bit of Flexeril to go to sleep, which is what I did. Okay, so David, Heather's tummy fiber is a really good option. This is acacia fiber. It is for people with a very sensitive bowel, very sensitive bladder. This could, a tablespoon a day, twice a day, so you start out with a teaspoon, start out with a small amount, work your way up. This could actually help a lot, David. And then this is a newer one. This is kind of the trend in fibers right now. This is called Regular Girl. And I know you wouldn't necessarily, we need one that says Regular Guy. Unfortunately, I don't think they have that. But it's the same thing. It's a prebiotic fiber with a probiotic blend. And you're going to see more fibers with probiotics in them. And I was working with another patient. What was she doing? What was she doing? She was doing something really odd for her bowel movements. She believed that her bowel movements were related to yogurt, something like that. And I mean, we had a really interesting discussion because she really didn't understand what fiber does. Yeah, man, you need the beneficial bacteria, but you have to feed the beneficial bacteria, and it's the fiber that feeds the beneficial bacteria. So we had to try to get her back on a fiber regimen. Um, David, another one that you could look at is Miralax. Miralax gets really good reviews from IC patients, doesn't irritate the bladder at all, and that would be something that I would look at. Guys, remember too that the way bowel movements work is it's food in, poop out. So you don't normally have a bowel movement when you first get up in the morning. You normally have a bowel movement after you eat in the morning, because the way the gastrocolic reflex works in the gut is when you put food in, that stimulates the process to eliminate food on the other end. Some patients will just try to force it and strain every morning before breakfast, and it just doesn't work that way. Also, there are some people who, you think you need to have a cup of coffee to have a bowel movement in the morning, and that's true. Having a warm cup of something, especially something with caffeine in it, can certainly trigger things to move along. I know for me, I don't do caffeine every day. I don't do caffeine hardly at all. I mean, I've had one caffeinated coffee in 25 years. If I'm going to do a little bit of coffee, it's always going to be decaf. But even if I do that, there are some times when it has a little bit more caffeine in it anyway. I will be in the bathroom all day. I mean, it's just like how coffee empty, and multiple bowel movements throughout the day just from that little bit of caffeine. Hello, Debbie. Hi, Joe. Hi, Raina. I have IC, fibro, hypoglycemia, Hashimoto, Sjogren's, partial agenesis. You don't have a question in there, hun. Shotzi says, have you tried taking magnesium? When I take it when I get constipated, for me, that's easy on my bladder. Yeah, but you got to use a tiny, tiny bit of magnesium. You don't use a lot of it. You use a lot of it and you take magnesium citrate. I read this hysterical thing about oh God, I should find it and read it. Oh my God. Oh my God, that would be hysterical. Hold on. Hold on. Hold on. I gotta find this. You guys want to die laughing? This was hysterical. Let's see if my dad. Let me see if my dad put it on his page, because he's the one that showed it to me. Let's see here. Hey, hold on one sec, guys. I'm gonna see if I can get him to mail it. You want to die laughing? Oh my God, this is hysterical. Hold on. Hey, Dad, do you remember that hysterical thing about can you find that and you didn't forward it? So funny. All right. Hey man, 96 years old, and he's as sharp as a tack. He's going to look for that and email it to me, because it was, you will die laughing. And laughter is the best medicine. When you laugh, your brain actually starts to minimize and deprioritize pain. So laughter is important here. All right, so we'll wait for that. All righty. Let's see here. All right. Now Facebook, behave. Sorry, I just have to move things around to get Facebook. And Adrian, Leanne, I just had surgery and had my bladder stretched and had 17 mast cells. They said I don't have IC, but I have all the symptoms. Had DMSO Friday and about to die. I'm in so much pain. Okay, so Leanne, wait. So they said that your bladder was normal. Okay, but they gave you a bladder treatment? They said you don't have IC, but they gave you a bladder treatment? Why? Why? DMSO as a therapy is definitely fallen out of favor for NIC. Definitely. Why? Because it causes more pain. DMSOs has many different methods of action, but we know that the FDA-approved dose of 50% can cause muscle spasms, almost sometimes irreversible muscle spasms. So DMSO is always meant to be used in a bladder cocktail formula, so that the dosage is actually reduced to about 20 to 25. So normally when you have a DMSO installation, it's going to have, what's it going to have? It might have a little bit of sodium bicarb in it. It's going to have a little bit of lidocaine in it, perhaps. Well, it might not have lidocaine in it. It might have some steroids in it. I mean, there are kind of different formulas that can be used for that. But I'm so sorry, hon, that you're having pain. Oh my God. Did you have your bladder stretched Friday? I mean, you're literally recovering from your hydro right now? Linda says, all my pain is in my urethra, but I've had Hunter's ulcers removed. I don't understand that at all. Linda, urethral pain is usually different than IC. So one of the things we ask patients is when is your pain the worst? Before you're peeing, while you're peeing, or after you're done peeing? If your pain is worse as your bladder fills with urine and you feel better after you pee, that's your bladder wall. If your pain is worse during urination, where your urethra is screaming while you're peeing and you're sitting there going, ow, right? And you're like stopping and starting going, oh, right? Okay, that happens after you've had your urethra stretched, but that can also happen with infection, or most of all, that's usually estrogen atrophy or some type of chemical irritation. So from a mini pad, like if I put on a pair of underwear, wash and shear or tie, I will have urethral pain within 10 minutes. And now we're looking at anything else that adds chemicals down there. So the urethral pain doesn't surprise me, but we're going to look really, in my opinion, based upon your age, at the quality and health of your skin. The urethra is kind of like the canary in the coal mine. So it is the first part of the urinary tract that's going to react to the loss of estrogen. And if it starts screaming, if you feel like you've got a piece of urine, urine stuck in your urethra that won't come out, that is in fact the dominant symptom of estrogen atrophy. Cindy says, how long does it take for you to see any benefits from bladder rest? Just like any other supplement, it's going to take a couple of weeks at a minimum, but usually 2 to 3 months. You got to remember that the bladder is the slowest healing organ in the body. Nothing happens overnight. Nothing happens overnight. It is physically impossible for the bladder to repair itself overnight. Okay, here, hold on. I think he sent it to me. Uh-oh, it's under. Okay, I got it. Thank you. Thank you. Okay. So I'm gonna. Okay, because laughter is the best medicine, and this is really hysterical. Oh, okay, but it's got a couple of cuss words in it. Oh dear. Oh, shoot. I got to try it. I got to try it, guys. I got to read this. Okay. Okay. And it's on a Facebook page. Leave it to my dad to find it on a Facebook page called All Things Tasteless and Offensive. What happens when you drink 10 ounces of magnesium citrate? I'm glad you asked. At 12:05, it's time. You shotgun a 10-ounce glass like it's a lukewarm PBR. I don't know what that is, like a lukewarm whatever. And you don't want to be oh God, I don't want to swear. You don't want to look bad in front of your older brother's friends. It's supposed to be grape flavored, but it's quite clear that whoever led the R&D team that day has never actually tasted anything grape in their life. You are already regretting this decision. At 12:06, 1 minute later, you swallow a cup. God, I have to take the swear words out, darn it. You swallow a cupcake like you've been saving it for the apocalypse because let's face it, that time is here. It's going to turn to liquid form before it even clears your throat, but you don't care. All is right in the world at this moment. Hold on to that. You are about to enter a very dark period in your life. 12:37, first sign of life. The pressure is growing. You already have 5 pounds of blank in your colon, and you basically just drank the safe for humans version of Drano. You feel it coming on. Finally, you think it's time. You're wrong. I can't read it. Oh, I can't read it. Okay. Oh, take note. This is the last semi-solid thing you will see leaving your body for the next 24 hours. 20 minutes later, that little science experiment you got cooking is about to reach its boiling point. Your stomach is angry now. It hates you. You can feel it. You have exactly 0.3 seconds to make it to the nearest toilet, but you can't run. Never run. You pray to God there is enough elasticity in your to keep the gates closed for 5 more steps as you start to preemptively undo your pants to save valuable time. Almost there. 3, 2, 1. 1 minute later. Sweet Mary, Mother of God, is this real life? your cheeks barely hit the seat and all hell breaks loose. you, I can't dang it. You've just what you've just created comes out with such I can't read it. Oh my God, I can't read it. Okay. Let's just say that you have explosive, you know what? Is that blood? False alarm. That's just a remembrance of the cherry pie you ate at Thanksgiving when you were 5. The smell is horrid. The sound is frightening. You try to clench what's left to soften the blow, but it's not working. The whole house just heard you as it Google. Okay, I'm sorry. From 1:06 p.m. to 8:30 p.m., everything's a blur. You blank everything out you've ever eaten since the day you were born, everything your ancestors have eaten since the early 1800s, and your rectum now feels like you have a flaming hot Cheeto and the tears of 1,000 jalapeno seeds stuck in it. You're now curled in the bathtub, ugly crying because you have to remain within arm's reach of the toilet at all times. You have the sweats. You meet Jesus. At 8:37, your family will never be able to unsee the things they've seen in the last 8 hours. You're broken. Your rectum's broken. Your spirit's broken. Life as you know it will never be the same, but tomorrow's a new day. You're going to wake up, throw on the only remaining pair of underwear you have that doesn't have a stain on it. You're going to run up to Target with the last shred of dignity you have left and buy yourself a new toilet brush. You've earned it. Oh my God. No, I have a really warped sense of humor because I work with bladders and bowels. That has to be the funniest description I've ever heard of somebody pranking somebody else and or doing a colon cleanse. And if I could have only said the swear words. You're broken, your blank's broken, your spirit's broken, life as you know it will never be the same. Tomorrow's a new day. You're going to wake up, throw on the only remaining pair of underwear that you have that doesn't have a stain on it. You're going to run up to Target with your last shred of dignity and buy yourself a new toilet brush. You've earned it. Now, you know what, guys? You got to laugh. You just got to find humor in the funny things. There's a girl online in our in one of our support groups. She was one of my early friends in the old AOL support group. She had us all rolling laughing because she was having a bad flare at a and they had to pull over at this nasty gas station with this absolutely filthy toilet. And her description of trying to pee on this toilet is hysterical. I think she ended up standing on it and squatting because she couldn't do it. And then what she didn't know is that she had gotten locked into the toilet stall. So she's done. And she's like navigated this terrible rescue situation. She tries to get out and she can't. And she has to crawl. She has to crawl underneath the toilet door on this filthy floor. The poor thing. Oh my God. So if you have funny stories to share, share them. Listen, we all have had colonoscopies. We've all had, Montezuma's revenge. We've all been there. We've all been there. Let's just try to find a little bit of humor in it too, okay? And I hope I didn't offend anybody. I don't think I did because I didn't see anybody leave, but I can have a really warped sense of humor sometimes. You just have to. Here, hold on. Now that I've cried and messed up everything. All right. Brenda says, where do you find an IC clinic in Kentucky? Brenda, come to our website, look at our database. We have a database on our website. Find a provider, go there and take a look at that, okay? You can also look at the ICA's. The ICA also has a find a provider database, but unfortunately it's not public. You have to join them to get it. You have got to sign up to their mailing list to get it. You can also go to pelvicpain.org and look at their database. On our website, in our Find a Doctor section, I give links to all the databases online that you can search. So we'll find a clinic. Also, the University of Kentucky has its own IC research center in Lexington, and the name of the doctor is Deborah Erickson. Deborah Erickson. Hi, Betsa. June 12th surgery. Why did she do a DMSO is beyond me. I've just been crying with a heating pad. Lan, listen, girl, if you had a hydrodissension 5 weeks ago and you are still in pain, something is seriously wrong. You need to get back to that doctor right away. You could have picked up a post-op infection. You might have that's very common. Post-op infections, bladder infections after hydrodissensions are common. But this is not normal. You should not be crying with a heating pad. Hopefully, I would like to know if you had your post-op examination. Oh, Shotzi, you just read that to her husband. Shotzi, you know the words I was leaving out the end, right? Sharon says, thank you, Jill. You give me so much hope with healing my IC, which I suffered for 34 years. I was told there was nothing they could do and they would have to live with it. I've decided to go back and let them have a look at my bladder again. I'm dreading this, as it always made my urethra hurt for months later. But Sharon, listen, the equipment gets better. Hi, man, all the equipment they used on us 25 years ago, those really big, thick cystoscopes, they don't use anymore. They've got much better, smaller equipment. So it might be okay. But if you're going to have a hydrodistension with cystoscopy, make sure it's a low pressure, short duration. You don't want a high pressure. Carrie says, any stretches you can recommend during a flare-up or just any stretches that can relieve pelvic and or bladder pain? Carrie, my dear. The things we do, right? Like, seriously. Okay, you need to get yourself this book, my dear. You need to get this book because this doesn't just have one stretch. This is all about stretching. This is all about the things that you can do to work on muscles and your pelvic floor. But this one right here is, I think, the most important one, squatting down. They call it a prayer squat because when you squat down, it's putting your pelvic floor exactly where it needs to be. So if you start feeling your pelvic floor getting tight, you're at the bank, seriously, just accidentally, quote, drop your keys and then squat down for just a second or two in this position while you pick it up. And that may get that muscle to calm down a bit. Hey, I'd like to take a moment and thank our sponsor, Preleaf. Preleaf is an over-the-counter supplement based on calcium, which can help you eat more acidic foods. Preleaf is the sponsor of these online support group meetings, and I'm very, very grateful for their support. So if you haven't tried Preleaf before, here you go. This is a bottle of Preleaf right here. It's a little calcium pill, or you can get it in a little packet. This has been around for almost 30 years now. It is the most widely used supplement available. It doesn't treat your bladder at all. All it does is reduce the acid in your urine, so foods won't be as irritating. So if you haven't tried Preleaf yet, give it a shot. Now, the only thing I'm going to say here is if you're prone to calcium-based kidney stones, then you wouldn't use Preleaf because it is a calcium-based product. And of course, guys, more is not better. One of the things that a lot of IC patients do is you just start taking stuff like candy out of desperation. Don't do that with Preleaf because you don't want an overabundance of calcium. Like literally, you just take it before a meal. But this has helped many, many patients. If you're going to eat tomato sauce, if you're going to drink coffee, if you're going to have a little bit of wine at a wedding, this might help. Carrie, this book, Ending Female Pelvic Pain, is available in the IC Network store right now. So Leanne says, Friday was your post-op. So what did he tell you on Friday? Hello, John. Hi, Gigi. Hello, 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 hello. Carrie, you know what I'll do is I'll post it on either the IC Network page or my personal page. Okay, absolutely hysterical. Gigi, what are your thoughts on cyclosporin to be used to treat IC? A lady in an oxalate group I'm in said she takes it and it's greatly helped her IC. And you know what? Cyclosporin is a step 5 treatment option. So remember, we have 6 steps of treatment. You start at step 1, you do everything in step 1, you go to step 2, then you go to step 3, go to step 4, go to step 5. Step 5 is the last treatment before surgery. Cyclosporin is normally used in people undergoing organ rejection. It's a big time medication. However, in small doses, what they have found that it can be remarkably helpful for people with bladder inflammation, and it is changing lives for the better. A number of IC patients are using it now. The reason why it's in step 5 is because it can have some pretty serious side effects, and some doctors would be uncomfortable doing it. The biggest side effect with the cyclosporin is going to be potentially high blood pressure. I have a very, very dear friend who has been taking it. She's a very, very severe IC, and it's changed her life. None of the other therapies worked. Did the cyclosporin, and she is off of her pain meds. She's doing much better. She's working, and she's happy. And it was 18 months that she started getting some high blood pressure, and they had to address that. But other than that, the cyclosporin is very, very viable. It's a good thing. It's a very, very good thing. John asked, what are my thoughts on Botox? You know what? When I was going through my feed earlier, one of the IC groups, somebody was talking about Botox and saying it caused cancer and all sorts of stuff like that. That's certainly not true. Botox, normally Botox is used to silence a nerve that would, as an example, be triggering, you scrunching up your face, right? So you could do Botox up here and around here, potentially to help reduce fine lines. Botox has been used for many, many years medically also. So Botox has been used, I think, in TMJ. It's been used in many, many different medical conditions. They started using it in the IC world probably a decade, 15 years ago. And normally what they would do is if this is your bladder wall, they would just kind of do random little injections of Botox around your bladder with the hope that they would silence the nerve that's causing the frequency urgency. Botox is a step 4 treatment option. The biggest risk of Botox as they're doing this is if they accidentally silence the nerve that controls your ability to urinate, you may have to self-catheterize for a couple of weeks or a couple of months until you can urinate on your own again. And that's exactly why Botox is up high at step 4. It used to be in step 5, step 4, rather than in step 1 or step 2. Botox would never be done in somebody unable to self-catheterize, such as somebody who's elderly. And that's one of my pet peeves right now. I mean, I think to me, it's a serious peeve, is that we often see doctors with bladder stuff kind of acting in a predatory way towards people in rest homes and convalescent hospitals. And so they started doing a lot of InterStim in that senior population, and they've started doing a lot of Botox in that senior population without understanding that, estrogen atrophy in a woman is going to cause frequency urgency if you give her freaking coffee and orange juice every morning, which is pretty much what every convalescent hospital does. And so it's only normal that an elderly woman with a very dry bladder, you give her coffee in the morning, she's going to be crying 2 hours later and asking to use the bathroom all day. So what do? They give her InterStim, they give her Botox, but they never take the coffee away. I've had more than a few discussions with dietitians at nursing homes and convalescent hospitals about this, because it's a crime what happens to these patients sometimes. So, I mean, Botox is viable. It's a viable option, but what else is in step 4? What else is in step 4 is neuromodulation. You can do the ankle stim, the urgent PC, or you can do the InterStim. So of all the step 4 treatment options, I would start with the ankle stim first, because there are no serious side effects with that, whereas there are very serious side effects with InterStim. And Botox, the reason they reclassified it from step 5 to step 4 is they discovered that if they used a half dose, patients didn't have as much urinary retention. So that's why they reclassified it to step 4. Bernadine says, the name of the book again? Ending Female Pelvic Pain by Isa Herrera. Okay. Hey, so let's do a reveal. Guess what came in? We finally have it. Peora. Now, for those of you who have followed IC research, in mid-May, we had a new research study presented at the American Urology Association, which found that PEA, not this specific, it's a variant of this product, PEA was remarkably successful at reducing pain and discomfort in the IC patient. It was researchers in Italy who did a study on palmitoethanolamide, PEA, and IC. PEA has been used by chronic pain patients in Europe for a decade, and Canada for a decade or longer. Patients in the United States have known about PEA also for quite some time. However, getting it into our country has been very difficult. We've had a couple of compounding pharmacies, one down in San Diego, who was able to get it in, but the cost was absolutely prohibitive at a couple $1,000s for, a small bottle. So things have changed. It is now more affordable, and the Italians decided to explore if PEA could reduce the pain of IC. And the data from the study is remarkably good. So this is our latest IC Optimist, and in our report from AUA, we talk about this, and let me just read this to you. PEA supplement helps with IC symptoms. If you can see that there. In Italy, researchers did a study with 23 IC patients who had not responded well to traditional prescription medications for treating their IC symptoms. Each patient began taking 100 milligrams of ultramicronized PEA a day. The patients who had an initial exam history and evaluation of their symptoms were followed at 3 months and 6 months. By 6 months, 75% of patients had a significant decrease in pain, and 25% were pain-free. No side effects were reported. And at 3 months, it was 87% of patients. At 6 months, 100% of patients had a significant response in their pain, of which 25% had actually become pain-free. Such staggering results from a supplement is encouraging. And the doctors at AUA immediately started asking, can we get this? Can we get this here in the United States? Ironically, at the same time, the company that was working on Bladder Builder, that IC project that I've been part of for about a year, they were able to negotiate a contract to bring PEA into the United States. And after the study was released, they decided to try to create a formula as close to that research formula as possible, and they did it. It's called Peora, and it's really exciting. The doctors are excited, we are excited, and it's exciting because so many of you have been taken off of your pain meds. I mean, it's so easy for doctors to underestimate the agony of bladder pain. You don't know what it's like until you've been up all night bawling your eyes out with pain, as you have been and as I have been. And so to be able to have something like this that can take that edge off that pain, if not eliminate that pain over a period of time, is an option that I think is worth exploring. Because the enemy here is suffering. The enemy here is pain. And if you've been cut off your opiate medication, if you don't have any pain relief, this is certainly worth trying. And best of all, it's the price, $29. It's the cheapest supplement out there, $29. So when that study came out, I took that to Natural Approach Nutrition, and I said, oh my God, look at this study. They already had the PEA, and they said, and they were so excited. So now they're doing a whole line of kind of PEA products. And this is their first one that was created specifically for us, for the IC community, for the pelvic and bladder pain community. So you can get this right now in the ICN shop. We just got it. We only got 500 bottles. And so get it while you can, because there's like a month turnaround before we can get it again. Okay. So how cool is this? They're working on another formula, a chronic prostatitis formula that I think is going to be fantastic. They have their first patients using it. I just talked with them yesterday, as a matter of fact. And a couple of more PEA things in the works. So it is exciting. There are companies that have the agenda of making money, and there are companies that have the agenda of wanting to help, and or they find that right balance. And Natural Approach Nutrition, the company that made this, is led by a gentleman who was a victim of surgical malpractice. Um, and the doctor that did his prostate surgery just butchered him. And he has been struggling with pelvic pain ever since, although finally he's better. He's had 12 surgeries, not a typical IC patient. He's in a whole nother category of medical malpractice. But once he experienced the suffering that we have gone through, he was like, I need to do something about this. And so because he was the CEO of a couple of other companies, including a couple of beverage companies, and because he'd already funded kidney research, he was like, okay, it's time to dedicate some time to IC. And this is one of his projects. And we are ecstatic, absolutely ecstatic. The other thing that I have to show you is, in fact, our new magazine. This is a reveal. They had a printing problem with it. It turned out when they printed it and they sent it to us, a lot of the images had streaks through it. So they had to trash them all and print them again. And so that's why it's late. That's the first time in 16 years that has ever happened. And so for those of you who get our magazine by email, you can download it immediately on your member page. I will have the email sent to you early this week, hopefully. If you're getting it in print, it's in the process of being mailed to you right now. Okay. So I wanted to go over what this is in that. This is a big double issue. This is one of the biggest issues we've ever done. And it's a joint spring summer because we had to I had to write a part of a book for Harvard in the spring, and I just couldn't whip out a spring issue. But what's in this? The first thing that's in this is a whole discussion about chronic infection. Because that has always been a hot button in the IC world. Like, is IC infection? Is it not infection? And the reality is that the bladder only knows one language: frequency, urgency, pressure, pain. Everything feels like infection. You could have a bullet wound and it would feel like infection. You could have a stab wound, it would feel like infection. You could have cancer and it would feel like infection. The only way that the bladder can tell you that there's a problem is through frequency, urgency, pressure, pain. And of course, the problem is that you and I, we are taught that those symptoms are the symptoms of infection. And I can absolutely promise you that some of you right now have prescriptions for antibiotics sitting in your bedside table that you're more than willing to pop whenever you have these symptoms. And so this article kind of explores the history of that debate, starting with Dr. Paul Fukuzato. So Paul Fukuzato was the first doctor who believed that IC was the result of chronic infection. Unfortunately, his research method, his sterilization method, was flawed. So we think he was generating a lot of false positives. The second time infection reared its ugly head was with the Lyme disease community. They started making very blanket statements that any patient with IC could have Lyme disease. And of course, we all went out and had ourselves tested for Lyme. And of course, most of us are negative for Lyme. Then we had the National Institutes of Health research that found that during flares, IC patients often didn't have bacteria, they had fungus. They had fungal infections, candida infections. So here you've got frequency, urgency, you've got that lovely little prescription that you're saving in your bedside table. You feel the symptoms, you grab your antibiotic, you take it, you have no clue that you might actually have a fungal infection, and that antibiotic's just going to make it worse. And that's why next generation urine testing is so good, because that will tell you if you have a fungal infection. Then, of course, we had the research from Europe, which associated Hunner's lesions with viral infections. Epstein-Barr last year, polyoma BK. So we now know that the bladder can have different types of infection. It can have a bacterial infection, it can have a fungal infection, and it can have a viral infection. But so nobody can make blanket statements anymore that IC is the result of, quote unquote, a bacterial infection. Now, the real reason why you can't do that is because of subtyping. bacterial infection or any type of infection doesn't explain the patient who develops IC after chemotherapy. It doesn't explain the patient who develops IC after a fall or having a baby. And so we've got these 5 variants of IC. We've got lesions, which could be a virus. We've got bladder wall injury, which could be estrogen atrophy, chemical irritation, or maybe chronic infection. Number 3 is pelvic floor dysfunction. Number 4 is a nerve entrapment. Number 5 is central sensitization. You can't put all of your eggs in the bacteria basket. And when we look at those subtyping, the biggest subtype, really, in my opinion, is a muscle problem. It's not a bacterial problem at all. But the reality is that some of you actually could have infection. And that's why that next generation urine test might be interesting. At least it would give you some data. It would tell you if you have fungal infection. You could also, if you have Hunner's lesions, you could order a viral scan. That might be interesting. There is a lot of kind of debate right now about next generation urine testing because doctors don't know how to interpret the data. And they don't know how to interpret the data because we don't know what a normal urinary biome is. But it's a piece of the puzzle. So if you, for example, the woman who had the procedure a month ago and is in agony right now, there's a significant chance she could have a post-op infection. A next generation test could identify that. Or if they gave her a lot of antibiotics during the test and after the test, she might have developed a fungal infection from that. So that next gen DNA test can be useful. But you can't put all of your eggs in the infection basket. So anyway, this article goes through that discussion in depth. It's my editorial for this one. And I give all the research behind it. What else do we have? We have the highlights from the American Urology course. Every year, the American Urology Association annual meeting is the largest meeting where IC is discussed. They always do a big class on IC. We always try to go there so that we can get the latest information for you. So Stacy Shannon attended the conference this year in Chicago. I did not. And so she's written a wonderful article on that. And she has also summarized the latest research that was presented. And we'll come back to this for a moment, but let me just show you some of the other articles in here. We have an article on bladder endometriosis. Interestingly, we have a small company that's working on a new IC therapy. The delivery of Elmeron through liposomes directly into the bladder, which would eliminate the systemic potential eye side effects with Elmeron. They asked me to put a little article in there because they're looking for somebody to fund their work. The European Society for IC had their big meeting. We have a summary of that as well as their research. We announced our doctor, nurse, and physical therapist of the year. In our consumer alert, we talk about anticholinergic medications and dementia. This was probably the hardest article for me to write. We have long known that certain types of medications called anticholinergics can impact cognitive functioning in the brain. And many of the IC medications potentially fall into this category. So a new research study was released from England last month, and it was a study of like 300,000 patients. And what they found in this study is that certain medications, specifically amitriptyline, also known as Elavil, so that specifically the antidepressants and the bladder muscarinics, which are the detrols, the ditropans, were found to be associated with cognitive decline and dementia for patients over 55 who took it every day for 3 years. So I emailed my medical board and some other doctors after I got that study. And it's like, all right, holy hell, how the hell do I talk about this? because these are the medications that we've all taken, sometimes for years. And one of the doctors told me I was catastrophizing. He's like, okay, I'll take it. But Robert Evans, and I should read his response to you about it. Let me just read his response to you. Hold on, let me find it. He agreed with me. Okay. So in my letter to them, I said, I just don't know how to breach this with our IC patient community. Hopefully you've seen the JAMA study, that's the Journal of the American Medical Association study from the United Kingdom, which established a link between dementia and various anticholinergic medications. The study was able to establish a clear connection with both antidepressants and bladder antimuscarinics, both of which have been used by IC patients. The study suggests that patients over 55 who take them daily for 3 years have a 50% risk of dementia, 50% increased risk of dementia. Interestingly, the antihistamines, the hydroxyzines, and the skeletal muscle relaxants like the baclofens and flexerils did not carry that risk. So here, I want to read you his response to me. He says, it does seem like it's getting harder and harder to treat patients. Here are a couple of thoughts. Number one, we have always known that elderly patients can develop mental status changes, confusion, and even dementia if exposed to anticholinergics, which is why so many of us prefer to use mirabegron for patients with overactive bladder. Unfortunately, many companies refuse to pay for this as there is no generic formulation, thus forcing patients to take medications that are potentially damaging to their cognition. He says, I rarely use anticholinergics in patients with IC as I do not think they help decrease frequency. The reason that patients void frequently because of pain is not because of overactivity. So these meds will not decrease voiding frequency. I especially want to avoid them on patients who are on other drugs with anticholinergic activities, such as tricyclics, gabapentin, or antihistamines. And then he said there are other supplements that patients can try. He says we have some patients on Cysto Renew, some patients on Bladder East, some patients on Bladder Builder. We also have folks on freeze-dried aloe vera. And then what he said is, because I also talked about Elmeron. He says, if it turns out that Elmeron is pulled from the market, I will simply do more home bladder installations, which is something I offer to everyone. Patients can instill heparin or Elmeron along with Marcaine or buffer lidocaine 2 to 3 times a week. And if they do this, they have more heparinoid effect in the bladder than if they took Elmeron by mouth 3 times a day. This is a lot safer than an oral agent since there is no absorption of the heparin or the Elmeron due to the size of the molecule and no systemic effect. However, cost is a limiting factor. So, hell of a year. First, we've got the Elmeron issue, then we've got the Cysto Protect cancer warning, and now we've got yet another very, very aggressive discussion of cognitive decline with medications often given to patients with bladder symptoms. Detrol, ditropan, any of the bladder antimuscarinics, as well as the antidepressants. Quantity matters over time. If you're only taking an antispasmodic randomly, then the odds of you having any issues are pretty slim. But if you're taking a lot over time, years and years, it's very important, in my opinion, that you talk with your doctor about these risks and see if there is something that you can switch to that will not carry the same risk. Like, as an example, mirabegron. Instead of Detrol or ditropan, try mirabegron. We talk about the Cysto Protect issue. Cysto Protect still has not issued a public statement, although I have talked with them twice now. Mylan Pharmaceuticals, they just don't have a plan as yet. We have a story of a comedian with IC And she uses comedy to share her struggles. We have a very good article on CBD oil, what you need to know about CBD oil, how to get through summer cookouts, because seriously, I do not want you sitting at home. I want you to get out and go to that barbecue with your family and friends. And here are some tips on how you can do that. I did an article on summer survival tips. And I mean, seriously, guys, for those of you that are in this heat right now, this is really, really important right now. Number one, dehydration is your enemy, because when you get dehydrated, your urine gets super, super concentrated and more irritating. So please keep up drinking your water. But the second thing you got to understand is that some medications have a drug heat sensitivity effect or a photosensitivity effect. So you have to pay attention to how you're feeling on hot days. Some medications can make you more heat intolerant, like hydroxyzine, which it did for me. So it's important that you protect yourself on these super hot days. So we got some good articles in there on surviving the heat. Got an article on low acid, how to make low acid salsa. Oh my God. I've got, for the first time, I'm growing these almost white cherry tomatoes in my backyard. And they have like 0 acid in them. I ate 4 of them yesterday. Little tiny, almost white ones. So good. Homemade, homegrown white, yellow, even orange tomatoes are substantially less acidic than red tomatoes. And you might be able to get away with that. And then last but not least, physical therapist Mary Ruth Valicki did an article on a holistic perspective for IC and how we can approach IC from more of a holistic perspective. Let me just take a moment and go through some of the research that came out. Let's see here. The MAP Research Network found that if you have pain on your left side, the odds are you'll probably also have pain on the right side, that there's a mirroring effect. That's one of they're trying to create more phenotypes for IC. Researchers from Michigan did a big Hunner's lesions study. They found that tissue from Hunner's lesions had less proteins for healings than non-lesion samples. Another study on Elmeron eye issues from Emory. So they are now telling any patients who have used Elmeron who are having eye issues, difficulty reading, difficulty seeing in low lights, blind spots, fuzzy vision, anything at all like that, that you stop the Elmeron and you go see an ophthalmologist. This is a pretty big deal now. Research on next generation urine testing, which shows that next generation researchers from Florida and the United Kingdom did a study to compare next generation sequencing with traditional urine culture. They found that next generation sequencing identified significantly more types of bacteria, which of course makes interpreting that data even more. As Dr. James Malone Lee said, just because you've got a bacteria appearing, that doesn't mean that they're causing your symptoms. We've got good bacteria in our bladder too. One research study that I was really, really concerned about was a study which appeared to suggest that IC patients were being overprescribed opiate medication. And I remember I sent a letter to all the doctors that I work with before the conference expressing great concern that this study would be used to deny IC patients pain medication. Happily, that did not happen. So in response to the recent concern over opioid use, researchers from Virginia took a look at how often opioids are prescribed for IC patients. They found that 26% of IC patients had opiate prescribed within the first 30 days of being diagnosed. However, Dr. Phil Hanno, moderator of the session, said as he looked at the data, he saw that less than 3% of the IC patients studied had an ongoing prescription for opiate medications, which he thought was a terrific number and surprisingly low. He said it's reasonable. the general consensus was that doctors were not overprescribing opioids. That was critically important here. I mean, we needed to take any pressure off of doctors who might be concerned that this could lead to an issue. I hope that that makes sense. And it was good. It was very, very good for us. Okay. Another study talked about acupuncture, and it was a study in Illinois that looked at 21 IC patients, 6 weekly sessions. IC acupuncture needles were inserted along the pudendal nerve in the pelvis and the feet. Both groups of patients reported having pain relief from acupuncture treatment. The group who received electroacupuncture had a longer lasting pain relief and less pelvic floor tenderness. No patients reported side effects. So, acupuncture, go for it. Researchers from California looked at a diabetes medication, and they thought that it helped with IC. That's early research. Then we had the PEA study, which everybody was the most excited about. Study showed that patients under psychological stress can increase bladder pain, bladder sensitivity to pain. We knew that. A study from England, which found that installations could help recurring UTI, installations of antibiotics. A study on the urinary tract microbiota, where they were trying to figure out what a normal biome is, a urinary biome is. You've got a biome, we've got a fungalome for fungus, and we've got a viome for viruses. So this study found that Streptococcus was more common in patients with IC. E. coli was found more often in IC patients than control. But there wasn't a big difference between the controls versus the IC patients. So if you're one of those people where you think nothing's happening, I'm telling you, you're wrong. And if you want to read about it, you just need to get our latest IC Optimist magazine. How do you get this? You go over to the ICN shop, go to our website, icnetwork.org, click on shop, and you can buy single copies of it, or you can become a member. And it would be great if you could become a member, because then you'll get 4, and you'll have access to a whole bunch of back issues, because this is really good to give to family members and friends and doctors. Anybody who has the audacity to tell you that IC is all in your heads, hell, give them this. Let them do their research. Brenda uses gram flaxseed for constipation. Leanne says, Jill, thank you for all the information. You've helped me a whole lot. I'm happy to. Linda says she ordered Peora 2 days ago. Do I have to wait months to know if it works? No, you shouldn't. Again, couple of weeks. Sherry says, my bladder builder was $46.99. Guys, the bladder builder is, we started, okay. If we hadn't put PEA in the bladder builder, it would be in the 30s. But the PEA is very, very expensive. So the PEA added $10 per bottle in Bladder Builder. So Bladder Builder is, we started it at $44.99 just for the first production lot, just to give you a shot at it, see what you think. We increased the price to $46.99, and on Amazon, we haven't put it on Amazon. We haven't put Bladder Builder on Amazon. When Bladder Builder does go on Amazon, it's going to go for probably $65, but I'm going to keep it in the 40s on the IC Network page. Just Amazon takes a huge percentage. Bladder Rest is on Amazon. Also with Bladder Builder, because we had some complaints about patients having to take 5 pills a day, they reformulated it so you only have to take 4 a day. So same size pills. You get the same amount, actually a little bit more of the key ingredients, but they took out glucosamine and they took out MCT and put in more PEA. So if you were in the first lot of Bladder Builder, just know the second lot, which is what we're sending out now, you're only going to take 4 a day. Sherry says, I love Bladder Builder. I am now pain-free after using it 2 months. Baby! Yes. Yes, yes, yes. And that is the PEA. It's very exciting, my friends. Very exciting. I am so glad that you're doing well with that, Sherry. That is fabulous. Hold on a sec. Hey, Sherry, I would love it if I could use that as a testimonial. Would that be okay? I can take your name off of it, but we want patients to see successes, right? Sherry said you ordered the new bladder builder last night, $46.99 plus shipping was $56. So the shipping right now is priority mail because of heat. When the heat is over, you'll be able to get it first class for like $5. Leanne, if you'd like to get the book or the magazine, just come to our website, icnetwork.org, and go to the shop. Tanya says, you had the DNA test done. They found a couple of bacteria that were 10,000 or less. Lab said they are colonized. I don't understand this. The doctor says we don't treat this. So if they found beneficial bacteria, then yeah, you don't treat the beneficial bacteria. So that, Tanya, that's good news. That's actually really, really good news. What that means then is that you did not have a strong pathogenic strain of bacteria in your bladder, and they didn't find fungus in your bladder. So you can now move on to other things. Brenda says she can't take antibiotics because of C. diff. Yeah, absolutely. Hi, Courtney. Hi, Beth. Gigi says you've been taking nortriptyline for over 6 years, as well as hydroxyzine and imipramine before that. So, Gigi, you need to talk to your doctor about that. Let your doctor know that you've heard more about these issues with anticholinergics, and ask if there's another medication you can take that doesn't have that same risk. Remember, it's really concentrated in older folks rather than younger folks. Dave and Chris Haslop says, if y'all would just do CBD or THC, it would help tremendously. CBD absolutely helps people. There's no doubt about that. Somebody's at the door. We have another product we have is Hemp Max, which is CBD. Hold on one sec, guys. I'll be right back. Hold on. Oh, wow. Holy moly. Thank you. Yeah, that's neat. Thank you. It's crazy. I gave you the wrong item. Oh, no. Oh, thank you. Okay. Look at what just came. This just came for me. Look. Wow, guys. Holy moly. Look at what just came for me. Look at that. Wow. Wow. That's amazing. I think this was for my birthday last week. There's no, oh, here it is. Oh, here's the, this is the prettiest. Wow. Look at this. Holy moly. Okay, here's the card. What is this? Oh, happy belated birthday and many more. You're truly one of the greatest people we've ever met and are so proud and and new to have you in our lives and as a dear friend. Oh my God. Oh, you guys. You know, I might cry a little bit. The reality of IC, for those of us who've had it for a long time, is that you often feel very lonely and very unloved. And I have never gotten, I've only gotten roses once from a boyfriend, once. And no matter how you rationalize it, and no matter how hard,
Where's it from?
I'll tell you later. I'll tell you later. No matter how hard you look on the outside and you try to present, a strong front, and I am strong. On the inside, there's a tremendous loneliness at times. And you wonder if what you're doing is important, and you wonder if what you're doing is helpful. And most of all, you just crave people to care about you, especially for those of us who are single. And I couldn't have children. And so the thought of, so there's this part of my brain that's, thinking that I'm going to die alone in a hovel with nobody caring about me. All this, this women out there. And to get something like this is amazing. Because it tells me I'm not alone. So here's your homework, guys. You're gonna have one piece of homework from this meeting, and it doesn't have to be flowers, but there's somebody in your life or another IC patient who needs to hear that they're valuable and they're worthy. And whether it's flowers or whether it's a card you write them, would you please do it? A lot of people look at me. I mean, I'm the national leader. I'm proud of that. But I'm human. And I have the same fears that everybody else has. I want you to be able to see this. Oh my God, am I glad I answered the phone. Wow. Okay. So your homework when we're done is to make somebody else cry happy tears like this husband and wife just did for me. Unbelievable. Oh, okay. And of course, doing a live stream. Normally wouldn't have answered the door anyway, but boo, thank you. Thank you, Jesus. Thank you to the two of you who sent that to me. Absolutely so appreciated. All right, let's get back to your questions. Gigi, how can you wean yourself off of those meds? Well, you need to talk to your doctor about how to do it. Usually it's a gradual reduction of the dosage. Maria, how do you get the newsletter that you're reading from? You come to it's the IC Network magazine. So you have to come to our page, icnetwork.org, and you can order it there. Okay. There's a picture of the magazine right on the front page, and it's in a blog too. And actually, you know what? Let me just do that right here. Hold on a sec. Let me put that link right here in this chat. All right, Facebook, you have that link, and YouTube, I'm going to give you this link too. All right. Shotzi says, what is the variety of tomato? I've just started growing a heartless jalapeno called Felicity, a zero heat to make enchiladas and sauce and salsa, all heartless but flavors. You know what? I don't know. I'd have to go down, and it's way in our backyard. It's a perfectly round, pale yellow sphere. It's incredible. I normally like the little yellow pear tomatoes, but this little round yellow tomato is fabulous. Sherry says, I need Norco, hydrocone opiates, and so blessed my doctor prescribes them to me. My life depends on these opiates, lidocaine gel for your urethra, etc. So Sherry, again, it would be really, really interesting to see if the PEA might make it so that you might have to use less meds. Give it a shot. I mean, because it won't have the side effects, not constipating. Gigi says, can one of these replace nortriptyline or hydroxyzine? It's not about a direct one-to-one replacement. It's about trying things that have a similar effect. So hydroxyzine is an antihistamine. So you could potentially try other antihistamines, not Zyrtec. Don't want you to try Zyrtec, but some of the other antihistamines. But the antihistamines were not associated with a cognitive decline like the nortriptyline. So with the nortriptyline, that's the one you probably want to focus on. So you got to go have a talk with your doctor about what other antidepressants out there that don't have the same cumulative effect, okay? John says, which one would you recommend trying first, the Pure or the Bladder Builder? So the way we're doing it, this is how we're doing it. If you are not sensitive and you can like eat anything, I mean, you're not sensitive to meds, you don't worry about meds, you don't struggle with side effects or anything, and you're really robust, we would say try the Bladder Builder first, because Bladder Builder is a really robust, strong formula. It's got the chondroitin, it's got the hyaluronate, it's got collagen in it, it's got some vitamins, it's got the magnesium, calcium in it, but it also has the bifidobacteria, the lactobacillus, and the PEA. I think there are probably about 700 patients now using Bladder Builder, maybe more. And I've only had 4 reports of side effects, and these are people who had diarrhea for the most part. And so one of those ladies said that she always gets diarrhea when she takes probiotics. So we think it might be the probiotics in this for some of you. But if you don't have issues with probiotics, we would say start with the Bladder Builder. If you are uber sensitive and you're afraid to try anything like me, the simplest formula is the Piora. And or if you're going for straight pain relief and you like the other stuff that you're taking, like Desert Harvest Aloe, you could just take this on top of that potentially. There were no reported side effects in the study with PEA. And if for those of you who want to replace Cystero Protect because of the cancer warning on Cystero Protect, Bladder Rest. Bladder Rest has the same ingredients as Cystero Protect. We took the glucosamine out. We put in L-arginine and L-citrulline. It's in an avocado oil base rather than an olive oil base, so it's much more heat tolerant. Most of all, it is much cheaper. So you can get this on the IC Network website for $10 less at $39 rather than $49. We've taken out the middleman. I get to buy directly from the manufacturer now instead of a distributor. And that's because I keep pounding all of them. I said, guys, we need cheap. I need high quality, affordable. So there you go. I hope that helps. I'm going to write a blog on it this week too to help you pick it, to help you figure it out. Beverly asked what my birthday was last week. Thank you. I am 59 years old. Like, how the hell did that happen? It's so weird. Because I feel 25. I mean, honestly, in my heart, I'm 25 years old. It is so weird to have a 59-year-old body. So weird. Tanya says, can you tell me the difference between Interosa versus estrogen cream for vulvodynia? I want to discuss this with a new gyne because the estrogen cream bothers me. My doctor says IC and vulvodynia happen together. Well, We're getting some pretty good success stories with Intrarosa for people with estrogen atrophy. I'm going to tell you right now, we're getting some pretty good success stories, very good success stories. Um, my understanding of Intrarosa is that it is a precursor to estrogen. So what does that mean? It means that it's converted into estrogen. Here, hold on a sec. Let me just. It's a non-estrogen treatment for moderate to severe painful sex due to menopause. And hold on a sec. Let's get this right. So it's made from prasterone, Prasteron, a synthetic form of a substance your body produces naturally called DHA. DHA is important because after menopause, it becomes your body's primary source of sex hormones. But as you age, DHE decreases. Like DHE, Intrarosa is inactive until your body converts it into sex hormones, specifically androgens and estrogens, which remain within normal postmenopausal ranges. This is okay. I think I'm going to try it. To be quite honest, I've already talked to my gynecologist about wanting to try it. With estrogen creams, you're kind of stuck with the formulation that the manufacturer has. So as an example, Premarin comes from pregnant mare urine. It comes from horses. It's this despicable industry up in Canada where they keep horses pregnant. They basically just kill the babies or sell them off for meat. And these poor mama horses, they pee into a bag, and it's an industry none of us should be supporting. Premarin, because it comes from horse urine, is massively chemically adulterated to be safe for humans. And Premarin is notorious for causing side effects. I have a book on my shelf called Screaming to Be Heard, Hormonal Connections That Women Suspect and Doctors Ignore. She has a whole section on Premarin and the challenges with Premarin. But the biggest deal about Premarin is that it's very expensive, hundreds of dollars. So most IC patients don't use Premarin because of the preservatives. And Estrace is also a brand name that has preservatives, but it's not as bad as Premarin. Most of us use a compounded preservative-free estrogen cream where they take out all the extraneous preservatives. And so, Tanya, the bloating and the chest pain and the asthma issues, I don't know if that's from the estrogen or I don't know if that's from a filler. So you definitely got to sit down with your doctor and I mean, the chest pain, asthma, that means that you're struggling with an allergic reaction, and that's serious. Because if you're having asthma, you're having trouble breathing. So we don't know if it's the estrogen or the fillers that are doing that to you. So the Intrarosa might be very viable for you. Your doctor says IC and vulvodynia often happen together. That's true. Because we think of IC as an irritation of the nerves on the bladder wall. We think of vulvodynia as irritation of the nerves on the vulva. We often call vulvodynia IC on the outside. And they can have common root issues like estrogen atrophy. If you've got estrogen atrophy, that's going to affect your bladder and your vulva, making them both more vulnerable. Let's look at YouTube for a moment. Bernadine says, if you're on prescription pain medicines, would you take it interchangeably with Pure and gradually stop the prescription med? Well, I mean, you need to talk to your doctor about what the best strategy for you is. But what you said there makes sense. It's probably how I would approach it, but I can't give you medical advice. It's very important that you talk to your doctor too if you've been on a lot of prescription pain meds over time, because there's something called tolerance. There's tolerance. So there's addiction and there's tolerance. So what is tolerance? Um, well, let's take a step back. What is addiction? An addict is using pain meds to escape life. A proper chronic pain patient like you, Bernadine, we're taking pain meds to function. So we don't have to worry about you being an addict. However, there is dependence and tolerance. So what happens, what's so amazing about the human body is that when you put a chemical in it, especially every day, it's your liver's job to break that chemical down. And the more you are exposed to it, the better the liver gets at it. And so that's why over time with certain medications, you have to take more to get a beneficial effect because your body gets so good at breaking it down. So normally if you're struggling with dependence, it's a very gradual process because we don't want you to go through withdrawals. And withdrawals don't mean that you are an addict. Just withdrawals just mean that your body has gotten very used to the medication. So you got to talk with your doctor, girl. But it's an option. Bernadine says, how about a 75-year-old body when you feel like you're in your 50s? Yeah, man, that's the way I want to be. Sally says, 84, feel 50 except for the darn I see. We women, we rock. Remember, 100 years ago, somebody my age would have already had all their hair cut off and a little gray perm and wearing house coats. Yeah, that's never going to be me. I'm still going to shop in the junior department, which I do often, and wear my low-rise jeans. If they would please make them again. I hate these high-rise jeans because you get you get a bulge. A tummy, what do you call that? A cupcake? You get a cupcake? Okay. Donna, let's see. Okay. Let's go back to Facebook here. Carolyn says, Jill, is it worth having a cystoscopy with hydro to just rule things out? I'm scheduled in August. If you're not getting better, yes, absolutely. Normally, so let's say you had mild to moderate symptoms. So let's say you're getting it 4 times a night. You had some pain, but you weren't crying. You were just kind of a mild to moderate patient. You go to an IC specialist. What are they going to do? Number 1, they're going to take your history. Number 2, they're going to screen for infection. Number 3, they're going to test your pelvic floor. They're going to ask you any other questions to try to rule out anything else out, like fibroids and stuff like that. Then they're going to hand you the diet. They're going to tell you about the supplements and maybe tell you about Elmeron or hydroxyzine and send you on your way for 3 months. That is absolutely correct. Because so many of us have estrogen atrophy or whatever, and just modifying diet can dramatically reduce the symptoms. However, if in that 3-month time, nothing is changing and you're getting worse, that's when they go, all right, it's probably time to take a look at your bladder. Let's do a hydrodestension with cysto. Or if at your first appointment, your pain was very severe or you had blood in your urine, they're going to step that up and go, we need to take a look at your bladder. And so I'm not against having hydrodestensions with cystoscopy, Carolyn. If I'm in pain, I want somebody to look. I want somebody to look at the target organ and tell me what the hell is wrong with it that's making me cry. But when you have a hydrodestension with cystoscopy, how they do it matters. In the old days, 10 years ago or more, they did what we call a high pressure long distension. So remember, your bladder is like a little balloon. It's small. And then it would be accurate to do this. What happens is it fills with urine. It slowly stretches, right? And then it gets to the point where your alpha afferent nerve says, hey, I'm full. You pee, and it contracts back again, right? So it just gets big and small and big and small. In the old days, they thought that the more you stretch the bladder, the better. So they wouldn't just go to here, they would go to here. And they had to do it under anesthesia because hello, you'd be screaming bloody murder. And a lot of those patients back then had it in the doctor's office, and yeah, they were screaming bloody murder. The worst thing you can do to a hollow organ is stretch it. And so what they used to do is a high pressure, long duration. So they'd fill it up and then they'd leave it in there for quite a bit of time before they would drain it out. And of course, your bladder capacity has been increased. But at the same time, when you stretch the bladder to that degree, you risk rupturing it. Bladders break. If anybody in here has ever had hydrodistension and you come out of the hospital with a catheter, your bladder was ruptured, and it's going to take a couple weeks for your bladder to heal. So when the American Urology Association released their new guidelines for IC 10 years ago in 2011, they said no more high pressure long duration. We need a low pressure short duration. So now when they do a hydro, they do a little hydro, a little one. I had one 2 years ago. It's fine. So Carolyn, I believe in eyeballs on the organ. I think it's important for somebody to look at your bladder. Just if you got a Hunter's lesion, for God's sake, we got to get it treated. That's how they're going to treat it. If your bladder comes out perfectly normal, that is a fabulous success story. And what that tells us then is that your symptoms are not coming from your bladder wall. They're probably coming from your muscles or your nerves instead. So just make sure you ask your doctor if he's going to do a low pressure, short duration procedure, just like the AUA suggests they do in the IC guidelines. If he says, no, I'm doing a high pressure, I would not do it. If he's saying, absolutely, my goal is to not traumatize you at all, then I would do it. Also, I'm just going to say here that whenever you stretch the bladder, it does cause pain. It can cause pain. Now, for some people can go out to dinner that night and it's just not a big deal. Other people will be in bed for a week because the pain is intense. And so it's very, very important, in my opinion, to have a very small prescription of opiate medication, something like Vicodin, Norco, just in case. You don't need a lot, maybe just a couple of pills, 5 pills. Use a small amount to try to get you through that post-op recovery. But again, I had one 2 years ago, and it was a breeze. It was pretty easy. I hope that helped. If come to our website, read about hydrodistensions on our website and so forth. Carrie says, what is PEA? PEA stands for palmitoethanolamide. It has been a supplement that has been used in Europe for chronic pain for a decade or longer. It acts on cannabinoid receptors, but it is not a cannabinoid. It interferes with the pain processing. It is finally now available in the United States in the form of Peora. And we have a new IC research study with PEA that showed staggeringly good results. We are so, so happy. So, so happy. Jane says, why Zyrtec? Because the FDA issued an alert about Zyrtec a couple months ago saying that going off of Zyrtec was very hard. It causes Zyrtec discontinuation syndrome, just like Cymbalta causes a discontinuation syndrome. So what that means is if you've gotten into the habit of taking that medication every day for a couple months, when you stop the medication, you basically go into hallucinations. Your body does not react well when you stop the medication. John said, IC is such a lonely disease. I've only met one other man with it, but not in person. Dude, I was working with an IC patient yesterday for a couple of hours, a guy. I was working with a Denver Bronco football player with it. A lot of guys have it. Y'all just don't talk about it. But I want you to know you are absolutely not alone in this. We do have a men's support board on our website. We've had it for 20 years. I will just tell you that men read everything, but they don't talk a lot. They don't ask questions. But I mean, they call me instead. They're a little bit less uncomfortable talking about their symptoms online and in support groups. I'm so sorry to say. Interestingly, the first support group that I started, IC Redwood Empire, we had 9 men out of a group of, in the first month or two, out of a group of about 50. We had a lot of men, and a lot of them were pharmacists, and I'm a pharmacologist. So we used to sit down after the meetings to try to figure out if we were ever exposed to anything. It's very interesting. Nancy says, you've been recently put on hydroxyzine pamoate, 25 milligrams. Hun, I used that for years. I found it very, very helpful. It is an anticholinergic, but the antihistamines were not implicated in the dementia study. Tanya says, so you're sensitive. Will the PR help with bladder wall and frequency? No. The PR does not have anything in it that will help the bladder wall. So what you could do is you could combine Pura with bladder rest. You get the bladder coating ingredients from the bladder rest and the pain fighting ingredient from the Pura. Or you could just do bladder builder, which has both of them in it. Thank you, Leanne. Gigi says, when my friends say it sucks getting old, I say, speak for yourself. I'm not old. You can tell it for me because I got these here. I didn't have these 2 years ago. Like, where did these come from? John, how do we talk with our employers about how IC affects our work? I have a really good section on our website about disability and IC. I mean, if you have a very caring, kind employer, then, especially if it's a man, I wouldn't mention IC. I would just say prostatitis, and just say you're having some prostate issues, and that should generate immediate sympathy. But if you've got an employer that's pretty harsh and judgmental, your employer they're not entitled to your personal information at all. And under the Americans with Disabilities Act, you do not have to disclose stuff. That you just have to have a doctor's note that says you need to be out. So it's a odd situation. If you give them your diagnosis, they could potentially use it against you, even though that's against the law. I will tell you, I got fired when I went out on disability for my IC, and I sued their ass, and I won. It took 5 years, but I mean they settled, but I did win in the end with the settlement. Thank good. Laura says, you've been taking Zyrtec 30 years for allergies. Would switching to Claritin be better? Potentially, but getting off of the Zyrtec is going to be a challenge, and you're not going to be able to do it without doctor supervision, hun. Google Zyrtec discontinuation syndrome, because you're going to have to plan for it very carefully, and it might take you 6 months or longer to get off of it. So you got to talk to your doctor about that. It's going to be tricky. Sarah says, what is your opinion on hyoscine? Sometimes I think it works better than morphine. Any thoughts? Well, hyoscine is not a pain medication, right? Hyoscine helps you. Here, hold on. Let me just get it right. So it acts to reduce motility in the gut and in the bladder. So if you're having bladder spasms, hyoscine could be useful. They act in completely different ways. So morphine attacks pain at the spinal cord. Hyoscine calms spasms. It acts on muscle. Apples and oranges. But hey, listen, girl, if hyoscine gives you better relief than morphine, what does that tell us? It tells us that you're having spasms, that your pain might be coming from spasms instead. And that's a very interesting piece of this puzzle for you. So antispasmodics might be in your future, but uh, you know, I mean, to me, bladder spasms are the quintessential way for your bladder to tell you that it's very, very irritated. So the only time that I've had bladder spasms is when I had a really bad infection. And I'm telling you, those spasms were brutal. They were awful, awful, awful. And I used an antispasmodic diterpan to stop them. And I only took diterpan when I had spasms. So I always like taking a step back and going, okay, why is my bladder spasming to the degree that it is? Is there anything in my daily life that is provoking my bladder wall? And it could be a multivitamin, it could be drinking coffee, anything like that. If there's something consistently daily that is provoking your bladder, eventually your bladder just starts shaking. It's kind of saying, help me, help me, help me. Thank you, Linda. Gigi says, my second hydrodistension made me worse, so I would never have a second one done. I was in pain for well over a week. Again, it's all about how they did it, hon. It would be very interesting to get the surgical notes to compare your first hydro with the second hydro. My guess is with the second hydro, they filled your bladder more than they did the first, and that's why you had more pain. Allison from New Zealand. Hello, New Zealand. Nice to see you. Do you know how long it takes for lesions to heal after they've been lasered? Very quickly. They should heal within a couple of weeks. Also, do you know how long it takes lesions to form? No, I don't think anybody knows that. Hey guys, it's time for a bio break. 1 minute, time for a restroom break. Be right back. Thank you, thank you, thank you, thank you, thank you, thank you. And since we just did a bio break, you can tell my gamer we call them bio breaks instead of saying I've got to go pee, although I've been known to say that too. I want to show you my bathroom essentials. Essential number 1 is a Perry bottle. Fill it up with water. I have 3. Fill it up every morning, use it all day. Anytime you use a restroom, you rinse yourself off with water before you wipe. Because if you have vulvodynia, the chemicals in your urine are irritating your vulva. Toilet paper will not get those chemicals off of your vulva. Water will. Every member of the IC Network gets a bottle for free. They're $2.99 in the IC Network store. For God's sake, buy one. And they have this this tip where if you just push it, the water comes right out. It's not a spray bottle. It's this type of bottle. Rinse, pat dry. Okay. Number 2, you got to be really careful with wipes. Cottonelle, for example, is really irritating for some people. In general, I don't recommend wipes at all, although there are some cotton wet wipe. I mean, you got to even be careful of baby wipes. Look at the ingredients. If it's got alcohol in it, it could irritate that sensitive vulva or that sensitive urethra. The one wipe that I do use only rectally is going to be a Preparation H wipe. Why? Because it's got witch hazel in it, and that's very soothing. I think these rock. I just wish they weren't plastic. But anyway. And then, last but not least, coconut oil. Putting some coconut oil on that dry skin, if you're dry down there, if you're uncomfortable down there, this is a must, as long as you're not allergic to coconut. Some people use peanut oil. Some people use olive oil. I really like the coconut oil. That is the routine for a 58-year-old Jill Osborne, 59-year-old Jill Osborne. The coconut oil is the new, but man, I'm telling you, I've been using these since my 20s. And I don't have vulvodynia hardly at all. I haven't had a vulvodynia outbreak for 30 years until 6 months ago. So, all right, let's get back to your questions. I'm gonna have to go get some water too. Tanya, can the bladder wall be seen through an ultrasound? Can doctors see stuff? Well, what they can do is measure the thickness of the bladder wall with an ultrasound. They can see size, but can they finesse? Will they be able to finesse imagery of the bladder wall? I don't think so. I could be wrong, but I don't think so. Is it safe to take pyridium or azo daily? My urologist prescribed daily if needed. Emphasis on if needed, Samantha. It's the only thing that's controlling the urgency, frequency, and burning. My trospium, your antispasmodic, did help for almost a year. Then I had this flare up. In general, azo products are not meant to be taken daily for an extended period of time because, if I remember correctly, either kidney or liver problems. However, when you take it as needed, it's FDA approved for that. It's considered safe for that. But it would be really, so Samantha, whenever we have a flare, we got to try to figure out the type of flare that we're having. And the way that we do that really is with a very simple question. When is your pain the worst? Before you pee or after you're done peeing? If your pain is worse as your bladder fills with urine, and then you feel better once you pee, that points to your bladder wall. If your pain is worse after you're done peeing, that points us to your pelvic floor. And so burning is often a symptom of the pelvic floor. Frequency, urgency can be a symptom of the bladder wall. So I need to ask you, hon, when is your pain the worst? Before you pee or after you're done peeing? Shell says coconut oil burns you awfully. Really? Are you okay? That's the first I've ever. Okay. Hey, man. If there's one thing we got to respect in the IC world is we are all freakily sensitive. We have very different tolerance levels. So the question is what doesn't bother you? Another product you could try is where is it? Here it is. So another product that we really like is V-Magic, which is a Vulvar Care Intimate Skin Cream that uses olive oil, avocado oil, honey, and buckthorn oil. And so I have used this too very, very successfully. And so, the challenge, hon, we all got to remember mucous membranes, whether it's your mouth, your vulva, your vagina, your urethra, your bladder, all are covered with mucus for a reason. That mucus provides a protective coating. And when your mucosal barrier is dry, it hurts. Dry mouth hurts. Dry vulva hurts. Dry urethra, dry bladder hurts. So the way you treat that is with moisture. It needs moisture. If you have dry mouth, what do? You swirl water in your mouth. If you've got dry vulva, dry vagina, we got to get some moisture in there. And generally, it's going to be something like this, V Magic. Or, of course, you can use a compounded estrogen cream, which your body can use that estrogen to produce mucus. So if you can do that, that's reasonable. Or you can do an aloe vera gel, something like that. In Asia, for centuries, thousands of years, women use peanut oil or almond oil. But if the tissue is dry, it's going to hurt. That's why I use the coconut oil a couple of times a day. So azopyridium is a numbing agent. It numbs the nerves of the bladder wall. Hello, Nancy. Gigi says, what if our pain is both before you pee and after you pee? So then Gigi, what I'm then going to ask is, well, then where does it hurt? Is it internal or external? If you hurt after you pee on your vulva, then we're talking about estrogen atrophy and dry skin. But remember, patients get stuck in what I call the chicken versus the egg dilemma. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor? The reality is that they're both going to be involved to some degree because they're so interconnected. But one is usually dominant and one is usually secondary. And we got to try to figure out the dominant one. So let's say if you had a flare from drinking a soda. I had the worst flare of my life in a theater where I had 7-Up, a fountain 7-Up. Oh my God, I was dying. And I was crying in the car driving home. It was terrible. So the acid of the soda irritates the bladder wall. The bladder starts screaming. And then because your bladder's in pain, your pelvic floor muscles tighten to protect you. That's called the guarding reflex. You can't turn that off. That's life. When the bladder wall is irritated, that is our priority. We have to calm and soothe the bladder wall. So how are we going to do that? We're going to do that by drinking water, maybe using a little bit of baking soda in a glass of water to immediately alkalinize the acid in your urine, taking a Tums, taking a Pre-Leaf, modifying that diet, then doing something that is calming and soothing to the bladder, whether it is Peora, Desert Harvest Aloe, and you have to ride out that superficial irritation. Of course, we also want to rule out infection, all that sort of stuff. But more flares are caused by muscle injuries. So if you have a flare after driving in a car, after having sex, those aren't bladder wall. Even though you're feeling bladder symptoms, those are not bladder wall flares. Those are pelvic floor flares. So when those muscles get traumatized, what do? You got a healthy bladder, you got a healthy pelvic floor. You get in the car, you drive for an hour, your muscles get tighter and tighter and tighter and tighter until they finally start squeezing your bladder. And that starts triggering the frequency urgency. So for this patient, Pre-Leaf isn't going to work, Tums isn't going to work, water isn't going to work, because the fundamental problem isn't with the bladder wall. The fundamental problem is with these tight muscles. So in this case, what we're going to do are things that are going to relax muscles. So a hot bath, heating pads, a vaginal Valium suppository, a muscle relaxant, getting out of that car, walking around, stretching those. Like I can feel right now sitting here that I'm starting to get that little flickering in my left glute, left piriformis from sitting too long. Got to get up, move around, which I will be doing probably in about an hour. Alrighty then. Tabby says, what causes recurring infections? I seem to get them every couple of weeks. They won't go away. Tabby, is usually because of estrogen atrophy. So let's see. Let me get this here. So let me show you here. So this is a three-dimensional picture of your bladder, but it's a perfect three-dimensional picture for any mucous membrane. So we've got a top layer of mucus, and if you look at this top layer is keeping anything in your urine from reaching the cells that can be infected. And then, of course, underneath that, we have blood vessels and nerves. When you have estrogen atrophy, irritants in your urine and bacteria in your urine can actually reach these cells and infect them. So I attended a lecture by Dr. Anthony Schaefer years ago at I don't even remember if it was a National Institutes of Health conference or an AUA. And they talked about women who keep getting recurring infections. And it was really interesting because what they found, I mean, they studied these women in depth. They took urine samples every day. They did vaginal swabs every day to try to figure out why this patient kept getting infections. And what they consistently found is that 24 hours before it arrived in the bladder, it was in the vagina. So that then led the researchers to ask, well, why has the vagina become a safe haven for bacteria? And the answer comes right back to estrogen atrophy. And also, when you're older, your pH changes and it becomes a more friendly environment for bacteria anyway. And so what he said is, number one, any woman who gets a recurring infection, we never diagnose as a simple UTI. We're always going to diagnose that as a complex UTI. They're going to do the antibiotic sensitivity testing. They give you the antibiotic, and at the same time, they would give you estrogen. Now, in the future, what you're going to see is that some bacterial infections are going to be treated with other bacteria, because we now know that there is a robust population of beneficial bacteria that live in the bladder. And normally they control each other. You've got certain types of bacteria here, certain types of bacteria here, certain types of fungus here. And they're basically in a war, and usually the good bacteria win. But when you take an antibiotic, you kill them all, and all of a sudden you've lost the controls for the bad bacteria. And that's why C. diff and other infections happen when you take antibiotics and or yeast infections. So it's in the not so far future that we're going to start seeing different ways of treating bacteria with bacterial infections with good bacteria to kill the bad bacteria, as opposed to an antibiotic that's going to kill everything. And they're already starting to do that. And then they're also using bacteriophages, which is weaponizing a virus to introduce something in there that will kill those bacteria. So we're going to see changes in the next 10 to 15 years on how infections are treated. And we're also understanding now that typical urinalysis is just ineffective. It's ineffective. It doesn't isolate everything. And so the other thing I think I would do if I were you, Tabby, is I would do next generation urine testing, because what that will do is it will show everything living in your in your bladder, but it will also show any antibiotic resistance genes. So let's see here. Hold on a sec. So if you go to bladderhealth.org, you can watch videos of doctors who use this to help them understand why people are getting these complex infections. So this would be very interesting. But the really cool thing about this is it will also tell you what antibiotic genes, resistance genes, are present. And so look, I just did this. I'm going to show you my results. So I was struggling. So you can have next gen testing of your urine, of a vaginal swab, of sinus infections. I mean, it's what all the researchers are doing now. It's just, it is what it is. It's incredibly useful information. So look, here is the test that I just had. And you can see it's by a company called Microgen. And the first thing that pops out is this red line, resistance genes detected. I have drug resistance genes to aminoglycosides. Now, the really weird thing is that I have no memory of ever taking an aminoglycoside medication. And aminoglycosides are, oh, no. So amikacin, plazomicin, streptomycin, neomycin. Okay, I got to take that back. I've definitely taken neomycin, gentamicin. Okay, so what this test found is that my bacteria in my body will defeat aminoglycosides like gentamicin. And then, I don't know if you can see this or not. So this is what it found. Lactobacillus gasseri, Privitella, a Streptococcus, and a Gardnerella. And the Gardnerella was so small, there's no percentage. So this was a vaginal swab. And we were trying to figure out why I was having irritation on my vulva. But what's even more interesting is then it then gives you antimicrobial recommendations. And it lists a whole bunch of antibiotics, and then it will tell you which antibiotic will kill which bacteria. So as an example, the lactobacillus and the streptococcus is vulnerable to penicillin. The Prevotella is vulnerable to Flagyl and Cipro. Those are the only two that would kill this type of bacteria. The Streptococcus can only be killed by penicillin and cephalosporins like Keflex. The Gardnerella, which is commonly found in women who are struggling with bacterial vaginosis, other meds. And so the data that this can provide you is interesting. And to me, the reason why I had the test done is I thought I was having a fungal. I thought I had a fungal infection. And right here, fungi detected, none. And so when I got this, because I didn't believe my doctors at all, it's like, this has to be a yeast infection. When I got this and it said no fungi, I let it go. I just like, okay, it's not fungi. It's a little tiny bit of bacterial vaginosis, which if you're over the age of 50, you know exactly what I'm talking about, right? Here, I'm going to go get some water. I'll be right back. Normally, I don't get up and down this often. Sorry about that. I'm still going. All righty then. Becky says she's so glad high waist pants are back. I think they look and feel so much better on me. I don't wear jeans at all, though. I like low rise, not super low, just enough to get like right over the bladder. Although I will say that when my IC was really bad, I couldn't do low rise. I didn't wear jeans at all back then. All righty then. Let's see here. Everything that I've mentioned here, you can buy from the IC Network store, icnsales.com. You can find the vaginal stuff, the vulvar stuff under feminine hygiene. And you can find the Perry bottles under restroom supplies, $2.99, guys. Seriously, it's a deal. Do it. Shell says, you just started with physical therapy and estrogen cream. Good. Physical therapy is awesome. Good. Catherine says, hello from Anchorage, Alaska. Hello, Catherine. Gigi says, I have estrogen atrophy. My IC got worse after the vet. And that makes total sense, hon. If your vulva's dry and your vagina's dry, so is your urethra and so is your bladder. And that's why having something that will give you a coating effect is really beneficial. So doing the bladder rest, the bladder builder, the Sister Renew, the Desert Harvest Aloe is really appropriate in that circumstance because we understand how it works. It would give you a little bit more of a protective coating that your body no longer can make, along with, of course, discussing the use of estrogen with your doctors. Nancy says, I believe I have a bladder infection. Normally I'm right when I get on the I normally am right when I get one. The tribe, it's really foggy. I took a urine. Okay, your urine is foggy. Took a urine test on Thursday. It takes till Tuesday to get the results back. Is that common nowadays? Yeah, it can be because you got the weekend, number one. But number two, they're doing a better type of culture where it's going to grow a little bit longer. And so that's useful. And guys, if you're one of those people where you keep getting recurring infections, it's really, really important that you start tracking it. I don't want you to, from this point forward, accept a doctor saying you have infection. I want you to say, okay, what kind of infection? What's the species? Is it Streptococcus? Is it Enterococcus? Is it Micrococcus? Is it Staph? Whatever. It's important that you start keeping records of what it is. If you're getting the same infection over and over and over, then what we're going to say is that you probably have estrogen atrophy of some type. No, I'm sorry. That's wrong. If you get the same infection over and over and over, you either have an antibiotic resistant infection or you've got something in your daily life which keeps inoculating you, like a bathtub with jets in it, where the water collects in the jet tubules in your bacteria. See, so when you have a bathtub that has jets, they're little air tubes. The air tubes have to be installed at a downward angle, so any water that comes in will drain out. If the air tube is installed straight or slightly downwards, then you've got a chance, especially if they're installed backwards or installed downwards. What that's going to happen is it's going to become a nice big population of bacteria, perfect place to grow bacteria. And that's straight from the Center for Disease Control. If you go over to the cdc.gov website and look at that data, it's really interesting. Catherine says coconut oil really helps her and that she uses frozen coconut oil after intimacy. Yep. And it was a guy who told me about the coconut oil. Maria says, do you do one-on-one consultations? Absolutely, every day. It's called wellness coaching. And you can order that right on our website. It's $50 for 30 minutes. It's $100 for an hour. I will tell you, though, that if you just call our patient line and you just have a couple of questions, it's free. 90 to 95% of my time working with patients is all free. But if you want to spend a lot of time talking about your case, I would ask you to sign up for a coaching session. I will also say that coaching sessions get top priority in my day. Whereas the people just calling, if you get my message, that means I'm working with another patient. And I just answer patients in first come, first serve. And sometimes it can take a couple of days to get back, if not longer. I tend to make a lot of nighttime phone calls. I mean, so by Friday of the week, like on this Friday, I had 15 phone calls that I had to return of phone calls that I missed during the week. Whereas coaching sessions always get top priority. It is what it is, my friends. Thank you, Tanya. Tanya says, great meeting. Awesome. I almost forgot about it too. When I was laying in bed this morning, I was like going, God, I'd really love to go see Avengers Endgame. And it started at 12:30, and I went, wait, 12:30. Wait, is this the third Sunday of the month? And I was like, looked at my calendar. I was like, no, oh my God, I got to do support group meeting. I had challenged myself, honestly, the first, after my IC started, you have to set goals for yourself, right? You got to work at it. And one of my first goals, since I had my worst flare ever in a movie theater, was to try to go to a movie. But I never went with anybody else. I went alone so that I could leave without feeling guilty. And 25 years later, I still like to do that. I am weird. I like to do that. Janie says she's 70. Welcome, Janie. Becky says, can we use ketchup or hair dye squeeze type bottles instead? Hun, if they're new, sure. If they're new, sure. Laura says, do yeast infections ever go away? Well, hun, your body always is going to have a little bit of candida in it. It's just part of the normal human biome. The challenge here is that there is a condition which created an opportunity for the yeast to overgrow. And so our goal is to just get the yeast infection controlled again. And so depending upon where the yeast is, you can use a topical yeast product like nystatin. I will tell you that most of the vaginal yeast infections are now drug resistant to monostat and stuff like that. They might give you diflucan, and just know that taking 1 pill of diflucan, 1.5 pills of diflucan is not the miracle drug they once thought it is, because some infections are just too complex and you have to use diflucan every day for like a week. When you get if anybody ever gives you diflucan, you have to look at the product information sheet and see what it says about more complex infections, because candida is getting very, very good at being drug resistant. However, really, Laura, the thing you really got to understand is candida thrives in a warm, sweet environment. And so I got an absolutely wicked candida infection, a drug-resistant candida infection for 2 years. And I had taken Augmentin, although it didn't happen during the Augmentin, but about a month after I stopped the Augmentin, my friend Diane gave me a heated chair cushion that I used here in my office. And I loved it. I love the heat. About a month later, I had this massive yeast infection on my vulva, and it dawned on me afterwards that the heat created the perfect environment for yeast to grow. So sitting on hot seats, absolutely not recommended. Even in the wintertime, I would never buy a car with seated car seats. But ultimately, if you struggle with candida, there's a book you want to get, and I've got it right here. Look at that. This is such a pretty arrangement. I'm so happy about that. This is the book that I found the most helpful. So there's a book called The Yeast Connection, but there's also this book, The Yeast Connection in Women and the Woman. And one of the things that it really focused on is that you have to clean up your diet. If you're eating sugar, you're feeding the yeast. And So here, steps you need to regain your health. Number one, clean up your diet. And that means you got to get rid of all the sugars. Sugar, corn syrup, white bread, sodas, juices, anything like that that can feed yeast. And if you've ever made yeast bread, what do you do to get the yeast ready to make the bread? You put it in warm water with sugar, and then the yeast starts growing and bubbling. And I found during my candida infection, Laura, every single time I ate ice cream, it flared. Anything with milk sugar, that yeast went crazy. So they say avoid yeasty foods and beverages, especially dried fruits, mushrooms, condiments, alcohol, juices, leavened breads, bagels, pastries, pretzels, pizza, and rolls. In 2 or 3 weeks after you improve, you can try yeasty food again and see if it bothers you. Diets aren't forever, but after a few weeks or months, you may be able to relax a bit. Yet until you show significant improvement, stick to your diet. And they talk about some supplements like taking flaxseed oil. There are some non-prescription anti-candida substances, obviously, like taking probiotics, because the job of a probiotic is to kind of create a good atmosphere in your body, and good beneficial bacteria normally keep yeast under control. So anyway, garlic. I took garlic. I still have garlic. If the mosquitoes are biting, I take garlic anyway. So anyway, you might find this book, Becky, really, really good. But again, for me, ultimately, I really saw a very clear cause and effect with sugar and yeast. The other thing that book taught me is I used to eat a lot of pasta and bread back then. I mean, hello, we all did. We didn't understand. And it said that as soon as you eat spaghetti, pasta, as soon as it arrives in your mouth, it becomes the equivalent of a Snickers bar that's immediately converted to sugar. And I don't think I really understood that. I understand that now, which is why I only eat quinoa pasta. I don't eat wheat-based pasta. So I really, really try to keep my white breads. I rarely eat crackers. I don't eat white bread, hardly at all. My only indulgence is a cinnamon roll or a morning bun every now and then. Or if I make pie, I like to make fruit pies. So there you go. Anna says, does anyone have constant pain? I do not have flares in me. It's continuous. Anna, some people do, and we got to figure out why, hun. We got to figure out why. Why are you in constant pain? And it's going to come right back to that subtyping. Why do you think you have pain? And Anna, if you could tell us, where is your pain located? Is your pain inside your body or outside of your body? And is it? I'll wait for you to answer. Where is your Anna on Facebook? Where is your pain located? Back to Laura on YouTube with about candida. She said, we talk about diet. She said, that's good advice. That's one of the things my doctor did not tell me, is to stay on the diet until I showed significant improvement. She says, I have stomach and bladder sensitivity and my diet is super strict. The only way I feel I can improve is not eating nothing that flares me. Or okay. And so Anna, that's cause. So what I like about what you're saying there is that that's cause and effect. You are understanding that certain foods are irritating certain things. And so that's good, valuable information, but you still have to kind of take a step back and go, why is it vulnerable in the first place? Why is my bladder and my stomach more vulnerable in the first place? You might be like me, where it runs in your family. because I'm IC subtype 5 central sensitization. Everybody in my family on my mother's side has sensitive stomach, sensitive skin, sensitive bladder, and interestingly, I have relatives in Norway on my dad's side, and I asked them if anybody in their family had a history of bladder or sensitivity issues, and they said no. So that's coming right back to my Norwegian. I have Swedish relatives on my dad's side and Norwegian relatives on my mother's side. So it's coming right back to Norway for us. Okay, so Anna, your pain is on the inside in your bladder and your bladder region. So Anna, do are you food? I mean, this is a stupid question, but bear with me here. What foods trigger your pain? What was the last food that you ate that triggered your pain? You've had many infections and then pressure from it evolved into pain, constant for the last 3 years. Okay, so with the infections that you had, what was the infection? Did they identify it for you? You know that not just a bladder infection, what was the type of infection you had? Staph, strep, enterococcus, micrococcus, did they ever tell you? You do not. Okay, so so Anna, this is your homework. Your homework number 1 is I want you to get your medical records and I want you to see if you can look and start tracking what that infection was. Because that's important information here for you. When was the last time you had a positive infection? Okay, so you're saying it was different bacteria. And Anna, how old are you? How old are you? Or if you don't want to say your exact age, can you just say, are you over the age of 50 or under the age of 50? You're 60. Okay, so this all started for you at the age of 57. So, and you at some point in time tested positive for multiple infections, different types of bacteria. So, we would call this the genitourinary syndrome of menopause. You're more vulnerable to infection because you don't have as much mucus anymore because you are menopausal. So, is your vulva dry and is your vagina dry? Are you dry? Are you dry down there? Do you have dry mouth? Is anything dry? I think, listen, hun, again, menopausal women who get recurring infections are real. I absolutely 100% believe that you have infection, no doubt about it. Okay, so she says every time they do the test, you do not have infection. You just did a couple of days ago, and yes, you're dry. So are you doing anything for the dryness? Did they give you any estrogen cream? Jennifer says she has icy pain now that you're taking pre-leaf, aloe, Claritin, and you're on the icy diet. Cool. But Jennifer, we have to know, is it bladder pain or muscle pain? When is your pain the worst? Before you pee or after you're done peeing? Okay, so Anna, you're dry. Did they give you anything? You had your ovaries removed, and after that, it's the pain. Okay, and you do Vagifem. So Vagifem is probably not going to be enough. Normally, I mean, when did you have your ovaries removed? How did you have your ovaries removed 3 years ago? Girl, you are a perfect example of an estrogen atrophy genitourinary syndrome of menopause patient. Perfect example. Okay. So the Vagifem just might not be cutting it. You might need to switch to a different type of estrogen product. And Intra-Rosa might actually be really good for you, hon. I need you to make an appointment with your OBGYN, talk about your dryness, and ask if there's something else that you can do. And your okay, you just said, yes, your bladder pain started immediately after your hysterectomy. So concept number one now is you're just like me after my hysterectomy 2 years ago, I am now in extreme estrogen atrophy dryness on my vulva. It's like, holy hell, mother of God, what has happened down there? It is like, so I'm sorry for swearing, guys, but when you're sitting there with your pants on fire, that's what you do. And I think doctors underestimate what happens when you put somebody into a very sudden estrogen atrophy. And that's what happened to you. And that's what I'm going through right now. So basically, you are now at this phase. You have very little estrogen. I mean, you have very little mucus down here. And that's going to be true in your vagina, on your vulva, and in your urethra, on your bladder. So diet, so I would guess, my guess here is that I have two guesses here, is that there's something in your daily life which is defeating the ability of your bladder to defend itself. So if you're doing that 1 cup of coffee a day, or that multivitamin every day, or water out of a Brita water filter every day, you are defeating the ability of your bladder to protect itself because you just don't have a lot of protective coating or mucus. And then the other theory is maybe you now have a chronic infection deeper in your bladder wall, and that's when doing this next generation testing, I think is very justifiable in your case. Let's take a look, and I think it'd just be very interesting to see if you have any active fungus or any active bacteria. I'm now at your I'm at 26 months post hysterectomy, and I'm now having a little bacterial vaginosis now from it, because that's what happens when you're at that point. And so I've had 5 months of irritation, which we're trying to get a hold of. So I hope that makes sense. Jennifer, you say that you're in your bladder pain constantly? Oh, Anna says it takes time to reach you. You're now in Portugal. Well, hon, you can always call. It's just trying to make and you can sign up for a wellness coaching session. We can do Skype if you want. But ultimately, I don't really think you need a coaching session right now. I think you need to find an OBGYN, have them look at your skin. If it's showing extreme estrogen atrophy with what you're doing, then it's time to mix it up with another estrogen. And you got to clean up that diet. Your doctor in Belgium does not do it. Well, you might not need your doctor in Belgium to order it in the first place. If you just go to that website, bladderhealth.org, you may be able to order it yourself. They do work internationally now. And then you can just take the results to your doctor, but it might be interesting. Okay, so Jennifer, you're in a flare right now and you have constant bladder pain. So let's do the same thing with you. When is your pain the worst? Before you pee or after you're done peeing? When is your pain the worst? And you know what? I'm waiting for you to answer that question, I am going to stand up and take the pressure off of my pelvic floor and use my magical sit stand desk. And I'm going to cover my crepey skin. You ever scare yourself on a mini pad? I mean, I'm sorry, if you're using an iPad and you're looking down and it reflects back up from here and you see, like, oh my God. All right. So Jennifer. Okay, so you're having pain before you pee. Okay. When did your flare start? Did it start yesterday? Did it start today? Did it start a month ago? When did your flare start? You guys, when I'm looking down like this, I'm looking at YouTube. When I'm looking up like this, I'm looking at Facebook. Becky says, can compounded hormone cream go bad in hot weather? Sure, anything can go bad in hot weather. Okay, it started today. So did you do anything weird last night? Did you have sex last night? Did you go out to dinner? Did you eat anything risky? What do you think triggered this flare you're having today? All right, let's see here. Okay, so you have no clue what triggered your flare today. Do you still have your periods? Because it's very normal to flare the day that you ovulate for a couple of hours, 6 to 8 hours, or you could flare a couple of days before your period. So where are you in your menstrual cycle? So you don't have periods anymore. Okay. So we can rule out that sudden change in hormones from active ovaries. Did you you know what I've got here? This is our guide to managing flares. And when you sign up for the IC Network newsletter, our free newsletter, which is not the IC Optimist, it's our free e-newsletter, you will get this for free that you will be able to download. So let's just go over the most common flare triggers, okay? So let's see if we can figure this out. Flare, okay, trigger number one is food. So we know that for sure. And I will tell you that 1 cup of coffee a day, these are the patients who absolutely suffer the most, or 1 soda a day, or 1 green tea a day, or 1 black tea a day, because your bladder simply cannot repair itself with that daily acid wash. So Jennifer's 63. So Jennifer, we also know for you too that you are dealing with estrogen atrophy. It is a reality. It's not a disease process. It is what it is. Your body's ability to defend itself is now compromised by the loss of estrogen. So there may be some foods that you were able to get away with 10 years ago that you cannot get away with now simply because you don't have that nice thick protective coating. Um, so the top offending foods: coffee, green tea, black tea, soda, diet soda, artificial sugar, fruit juices, cranberry juice, orange juice, lemonade, limeade, all that sort of stuff. Multivitamins, if you take a one a day or Centrum, those are notorious for causing flares. If you're using any artificial sweetener, if you're taking chocolate, anything at all like that, we know that those are going to be much more problematic for your bladder because of its thinner menopausal coating. The second thing we're going to look at is hormones because of estrogen atrophy, so we know that's a play. The third trigger is going to be deriving or having sex, but that hasn't happened for you. The fourth trigger is going to be stress. Because when you're under stress, your body has a biochemical reaction to that stress. And what happens is that, I explain it here in this. So IC patients frequently report their symptoms worsen during periods of high physical or emotional stress. Consider the fact that when patients get very cold, they often have more bladder symptoms. Emotional stress creates a similar reaction. So if, for example, you're in the heat, the stress of that heat reaction could have triggered your flare today. Whether it's physical stress, emotional stress, those all trigger similar biochemical reactions. So several researchers have focused on how nerves in the spinal cord and bladder react to highly stressful situations. They have found that intense stress causes a neuroendocrine response throughout the body, brain, spinal cord, and that appears to worsen our pain levels. While this research continues, it's important for IC patients to remember that there's no shame in having an IC flare as a result of stress. But if it happens frequently, try to reduce your stress load or consider learning some new stress management skills, yada, yada, yada. Okay, so we know stress can do it. We also know that chemical exposures can do it. Okay, so Jennifer, you're having excessive heat. So you're just probably having a heat flare, hun. You're probably just having a heat flare. That's completely acceptable. I would just keep drinking water, use your pre-leaf. No, the weather's supposed to calm down in a day or two. You think you're supposed to get back to 88 or 81 instead of in the hundreds. I bet that's what you're having. It happens. Sam Widow says, is there any update on Lyris? Absolutely not. Lyris continues to be inactive and deprioritized by Allergan. So Samantha says her pain started as bladder spasms, negative for UTI. Doc put you on trospium, which helped. A week ago, the pain started back. Bladder spasms weren't as bad. Pain was mostly in the urethra. Urgent care said you had a UTI, but they didn't culture it. The leukocytes were increasing, so they changed the antibiotics. The last test didn't show bacteria in urine. Now you're taking up treatment for BV and E's, taking aloe supplements. It's helping. No caffeine, but you're still having pain in the urethra. If I don't take pyridium, it's extremely painful. Samantha, I have a blog on our website that talks about the 7 causes of urethral pain. That urethral pain can just be extra chemical irritation. It could be a chemical sensitivity. It could still be infection. I think you would be a really good candidate for the next generation urine testing, hun. I mean, you had an infection, you're not better, you still have leukocytes in your urine, they're still increasing. That means that an infectious process is probably happening, but their tests cannot identify it, which we know urine tests now are fallible. But the next generation urine test would potentially rule in or rule out infection. So if I were you, again, I would go to bladderhealth.org, bladderhealth.org, and watch those videos, okay? Hello, Fossey. Hello, Vivian. Vivian, you're catching us at the tail end of a support group meeting. We've been doing this for 3 hours. All right. It's time for a giveaway. What do you say? What do you say, people? Who wants a bottle of Peora? I'm going to send a bottle of Peora to one of you in here. But it's a giveaway. It's a contest. So I'm going to test your knowledge level. If you would like a free bottle of Peora, I would like the first person who names the medication. Hold on. Oh, my goodness gracious. The first person who names the medication, the first person on Facebook and the first person on YouTube. Okay, so it's send out 2 bottles. The first person who names the medication associated with pigmentary maculopathy is going, and that is the new eye issue associated with the only oral FDA-approved medication for IC. If you can name that medication, the first people who do it on Facebook and YouTube will get a free bottle of Peora. This is not hard. Okay, Lily Alvarez on Facebook. Got it. YouTube, anybody want to hazard a guess? If you don't, that's fine. If you don't want it, that's fine with me. YouTube, what is the only oral medication approved for IC that is now associated with eye disease? All right, Lily, this bottle is for you. I need you to send me by email your mailing address. And Joanne Meyer on YouTube, you got it too. So for both of you, if you can email me your mailing address to icnetwork@mac.com. That's M as in Mary, A as in Apple, C as in Charlie. I will send both of you a free bottle of Peora. And I'd be very anxious to hear what y'all think of it, okay? I'm writing my email in the comment, icnetwork@mac.com. icnetwork@mac.com. All right, there's my email address. I will send those out mañana. All right, my friends, listen. If there's one thing I want you to remember from this meeting today is that you have done nothing wrong. This is not your fault in any way, shape, or form. Or what did I say? This is not your fault in any way. You have done nothing wrong. You are not damaged goods. You are not unworthy. You are special. You are important. Your family needs you. The world needs you. It sucks to have bladder pain. It sucks. It sucks for a couple of reasons. Number one, nobody can see it. You look normal. They don't have a clue how miserable it can be for you, especially at night. And the odds are you've got some people in your life who are saying, "What's wrong with you? You haven't gotten over it." Or they say, "Oh, yeah, I had that too. I drink cranberry juice," whatever. It would be so much easier if it were a broken shoulder. People would have sympathy for a broken shoulder. It's hard to have sympathy for something that they cannot see, right? We are very good at negative self talk. We start thinking that we're unworthy. We start thinking that maybe our family deserves somebody better. But you know what? None of that's true. And here's the deal. If you had a family member hit by a car right now out in front of that window, what would you do? You would run out the door. You would run to their side. You would call the ambulance. You would ride with the ambulance. You would go hold their hand in the ER. And if they had a broken hip, you would bring them home. You would love on them. You would support them. You would do everything you could to get them through this crisis. Well, you're having the same crisis, and you deserve that same love and compassion and support from your family. And so if you need help, I need you to ask for that help. Don't suffer in silence. That's not okay. If you need help, if you need somebody to take you to the doctor, if you need somebody to run to the pharmacy for you, then you need to do that. Hey, Maria is saying, Maria, I'm writing it down for you. It's called pigmentary maculopathy. They now know that they now believe that a toxic byproduct of the Elmeron is building up on the retina and damaging cells on the retina. We've done many, many articles on it. We've known this for about a year now. If you come on over to the IC Network website, you can read about that, okay? Whatever happened to you in the past, whatever anybody said to you that demeaned you, whatever anybody did to insult or humiliate you, it is done. It is over. Let it go. Today is a new day. Tomorrow is a new day. And I want you to approach tomorrow not thinking about how bad you are. I want you to approach tomorrow thinking about how good you are. How good you are. Every day I need you to do 3 things. Number 1, do something for your soul and your spirit because you've suffered for a while. So whether it is going and sitting outside and watching the butterflies go by, whether it is reading your Bible or your Quran, whether it is going to church, whether it is listening to Joel Osteen, whatever, do something that gives you comfort. Comfort. And of course, I'm going to throw in here, it's very important that you do happy things. I need you to laugh every single day because when you laugh, your midbrain will deprioritize the pain. And we've talked about that before and other things. And so I want you for 30 minutes a day, would you please either read something really funny or better yet, watch a funny show on TV or better yet, watch funny animal videos on YouTube, whatever. I need you to laugh. I also need you to get out of your bedroom. Open up the drapes. Every movement is your body is designed to move. If you're laying down all the time, your body gets weaker. Your muscles get weaker. And so every morning, come on, get yourself out of bed, go pee when you need to pee, put your robe on, walk around the house. Better yet, every day, open up the front door or the back door, and I want you to walk a little bit. Even if it just means you're walking down the sidewalk to the street, do it. Do it. If you can walk a house away, do it. Let's get some movement in there because when you move, your body produces endorphins, which are natural pain fighters. Okay? Every day for 15 minutes, I need you to do something for your bladder or your vulvodynia. It could be soaking in a tub. If you've got vulvodynia, soaking in a tub for 15 minutes, a little bit of baking soda in the water is great. Or Make a good IC friendly meal. Or as you're driving by Starbucks, keep driving. Don't turn in, keep driving. If somebody hands you a lemonade, say, thank you, I cannot do that. And you go for the sparkling water instead. And then I need you to do 15 minutes to improve your knowledge level. We need to get your knowledge level up here. Nobody could ever tell me that IC is in my head. I will smack them down like they've never been smacked down before with research. And I'm no different than you. I just read a lot. I just read a lot because it's my job. You need to read a lot too. And I don't mean reading stuff on Facebook. I need you to actually read real educational materials like on our website, icnetwork.org, or the National Library of Medicine. Listen, even guys, come on, one blog a day, one article a day. You can read one article a day or one video a day because I think we have about 100 videos online now. We'll be doing a lot more too. Okay. I want you to practice reward therapy because you've never worked as hard as you are right now to get better. And I'm telling you, it absolutely sucks that when you're feeling the worst, you've got to be an activist. But you do. You just want somebody to come in and hug you and hold you and do all the work, but it doesn't work that way. You got to be prepared to kick some butt, including your own butt, to get yourself moving. And so reward therapy is important. When you do something hard, give yourself a reward. And you get to pick what that reward is. If you want to sit and watch a movie, if you want to read a favorite book, if you want to stop at Hot Cookies and get a sugar cookie, which I did for years. We had a great hot cookie store here in town. When you do something hard, reward yourself. Vanilla milkshake, I'm perfectly fine with that being a great reward. Stopping at Baskin Robbins, getting a vanilla or a caramel, whatever, ice cream cone, works for me. Reward yourself, all right? But remember, IC is below the waist. IC is below the waist. It's not above the waist. You still have your heart, you still have your soul, you still have your brains, you still have your hands. I need you to use them as much as you can. We tend to start thinking I can't do anything because I have pain, and that's not true. Remember, I had a doctor tell me in the emergency room, the moment that absolutely changed my life for the better was when I had a doctor be very rude to me, and he said, "You will forever be a burden on your family. You will always have pain. Get used to it." I looked at him and I went, "I will prove you wrong, you son of a bitch. How dare you say that?" It was such a wrong thing to say. And I have been pain-free. I have been mostly pain-free for years now. I am the exact opposite of what he predicted because I was determined to prove him wrong. I want you to prove your critics wrong. I want you to prove your critics wrong. Listen to a fabulous Joel Osteen thing. And I mean, I just like him, and I'm not a Bible thumper in any way, shape, or form. It would be very hard for me to quote Bible verses for you because I was raised in the Lutheran faith, which is a very cold, sterile faith, and it just never did anything for me. But I really like listening to Joel Osteen because he has very happy, encouraging words, especially if you're going through hardship. And he said something that really resonated with me. He said, if you've got somebody in your life who's critical, I want you to thank them. And I was like, what? He goes, think about it. When your dad said, you will never get through college, what did you do? Did you believe it, or did you rise? Did you rise above it? My father said to me when I said I wanted to go to graduate school, he said, you'll never get through it. And I just thought, I will prove you wrong. Not only did I get through grad school, I had a 4.0, a presidential fellowship. And there you go. And my grad school project was, the IC network. He talked about rising. He said, when you face adversity, it forces you to rise. It forces you to work harder, to work better. It makes you do things you would never have done if you hadn't had an obstacle. And the odds are it makes you better. And when I think about my work with the IC movement, When I started my support group and then started the first online support groups, let me tell you, if looks could kill, I would be dead. People were so angry at me for building the first website on IC and doing support online. They were furious with me. And they were demeaning and insulting, and they made up lies. They said, she's trying to profit off of patients. And my answer was, how? It's free. I'm not profiting off anybody. And even today, everything we do, 95% of what we do is free, right? But you know what? If I hadn't had those critics, I would not have succeeded because I worked my butt off to prove them wrong. And I want you to work your butt off to prove people wrong because you can do it. You can do it. And yes, you're in pain right now. Yes, you're in pain right now. And so what I need you to do, remember, what's the rule? You don't go to a doctor and say you have IC. You go to a doctor, you describe your pain and say, doctor, can you please help me understand why I have this type of pain? I have pain on my vulva after I pee. I have pain when I ejaculate. I have pain 6 hours after I have sex. I have pain when I drink coffee. I need you to focus on your symptom. You are an anatomical mystery to be solved. I need you to get your doctor to look at your body first. Until we understand your anatomy, every treatment discussion is a waste of time. Because if you've got pelvic floor dysfunction, you spending 3 months in Elmeron is a waste of time. If you've got Hunter's lesion, you doing 3 months of Elmeron is a waste of time, right? We have to understand your anatomy to find the right therapy for you. And what makes that hard is that we are all snowflakes. We are all different. There's tremendous diversity in the IC world. So your cause of pelvic pain is going to be very different than my cause of pelvic pain. And that's why support groups are hard, because we all think we're the same and we're not. Some of you your IC began in childhood. For others, your IC began after menopause. For some of you, IC began after having a baby. For others, IC began after you were raped. For some of you, IC began after chemotherapy. While for others, IC began because you had a crappy diet and you drank soda for 10 years straight and you never drank water. They are all different. And we're going to approach each one of those cases differently. A one treatment fits all approach does not work. It does not work. The good news is that now that we are subtyping, now that we understand the diversity of these patients, now we understand that IC is not an incurable bladder disease for a lot of us. That in fact, it can be cured in some of us. If you've got pelvic floor issues, muscles can be treated, and muscles respond beautifully to therapy. If you've got a chronic infection, if we can identify that infection and treat it, that could be cured. If you've got estrogen atrophy, you can't cure aging, but we're going to give you they can give you something that will help strengthen your tissues. You get it? You get what I'm saying here? I hope you do. Carry hope in your heart every single day. Every day is a new day. Don't dwell on the past. Focus on today. What can you do today to feel better? If you haven't been for the doctor for a while, why not call the doctor? Go have a discussion about your anatomy, okay? Hege says here, that's so true. Going for a walk is the best thing I can do for my bladder pain. Right, because when you move, you produce estrogen. Kainisha says, have you ever heard of bladder removal surgery? Of course. Of course, bladder removal surgery is a step 6 treatment option. We have 6 steps of treatment. You normally start at step 1, do everything in step 1 before you go to step 2. You do everything in step 2 before you go to step 3. Then you go to 4, then you go to 5. If none of those have worked, then yes, we're going to talk about potentially bladder removal. Thankfully, it's very rare. Most patients at some point in time, though, go, doctor, can't you just take it out? And the answer is, hell no, we're not going to take it out. We're going to try to figure this out first. So, Kainisha, over on our website, on the IC Network, I want you to go watch our video, The 6 Steps of Treatment. You're on Facebook. And the 5 subtypes of IC, I think you can find the 5 subtypes of IC video on Facebook. But if you go to our website, icnetwork.org, watch the video, The 6 Steps of Treatment. We have a bladder removal board over on the IC Network support forum. And so the answer is, did it work for them? Yes and no. If you have a very small, shrunken, damaged bladder, so normally your bladder, it will hold like 500 cc's of urine. If your bladder has been profoundly damaged, scars, and now it's the size of a walnut, then bladder removal surgery is certainly going to be considered at that point in time, because you need capacity. Or they might do an augmentation where they increase the capacity of it. But I remember at my first appointment, I asked my doctor to take my bladder out, and he said no. And I said, why? And he goes, because you haven't tried anything yet. And I'm so glad he said that, because once I started doing therapies, I got better. And with the subtyping, it works. Kenesha, I will have you know that I had a hydrodistension 2 years ago, and my bladder is completely healthy and normal, because I have a different subtype. My IC subtype is not my bladder wall. My IC subtype is my pelvic floor muscles combined with IC subtype 5 central sensitization. Edith says, what are some of the foods in your diet? Well, I haven't eaten anything today other than a couple of bites of toast, which is terrible. So normally what I do for breakfast is I will do scrambled eggs. I love Ezekiel bread. I do not eat white bread at all. So I get easy. Let me go get a package of Ezekiel bread so you guys can see this. Hold on. Ezekiel bread. It's a flourless, low glycemic, high protein, high fiber bread. And it's not made with any flour, it's made with sprouts. So this is ideal for people who have irritable bowel syndrome. And I started eating it when my IBS was really bad, and thankfully my IBS is almost gone too. So this is my morning staple. I will either have 2 pieces of toast, or I will make 2 pieces with French toast, with an egg and a little bit of mocha mix and something like that, right? So this is the bread that I eat, and I love it. I love avocado toast in the morning. So this bread with some avocado on it, or this bread with some almond butter on it, or this bread with scrambled eggs on it. I'm doing kind of a protein thing right now, and so I'm cut way back on carbs because I'm trying to eat this. I'm trying to eliminate this stupid, menopause belly. I can't stand it. For lunch, I will either do a sandwich with this, or I will do a salad, like a pea and cucumber and carrot salad. Or I will do celery with almond butter, or I will do an unflavored yogurt, rarely, because it tends to be high carb, and I'm really trying to work on that. For dinner, I go to town with dinner. And my best friend just came in, and she can tell you, she could tell you that when it's dinner time, let me tell you, I can chow down on dinner. I just eat normal dinners. So we had Mexican food 3 days in a row this week. So the first week we did fajitas, chicken fajitas with bell peppers and refried beans and rice. Then because I had so much left over, I did another Mexican, and then I had another one again. So we did Mexican food 3 times in a row. Last night we did a hamburger, rice, carrot thing. I don't eat green salads because I have gastroparesis. I eat a ton of salad, though. I just eat cucumber, pear, carrot, beet, stuff like that instead. And I have to tell you, it's amazing how much better you are when you clean up your diet and you get rid of the sugars and all that other stuff. My snack is popcorn, microwavable organic popcorn, usually. Kim says, there are subtypes? Girl, where have you been? I say that in the nicest way possible. So let's talk about this for a moment. Now, remember what I was just saying before is that, listen, there's tremendous diversity in this IC patient population. We are not all apples. We are every fruit in the spectrum combined with a lot of vegetables too. So a one treatment fits all does not work. So what researchers have been doing now for the last decade is really trying to figure out what those unique variations are so that we can focus on the right treatments for you specifically. So in Europe, they base their subtyping on biopsy results along with what your bladder looks like. So in the European system, there are 12 subtypes. So their worst subtype are the patients with Hunner's lesions combined with biopsy results that show profound inflammation. Okay. Their lowest scenario are the patients with a normal looking bladder wall where their biopsy results might show just a little bit of mast cell activation. We don't use that system in the United States because, frankly, our insurance companies won't pay for it. That's very exclusive to Europe. In Canada, they use a system called U-Point to create their subtypes. In the United States, because we don't have an agreed upon system, I use a system that was proposed by Dr. Christopher Payne, who ran the IC research program at Stanford for 25 years. And I just think, I think the world, I love the IC researchers out there. I mean, Chris Payne, Ken Peters, Rob Moldwin, Rob Evans, Phil Hanno, all those guys. Let me tell you, they have dedicated their careers to understanding IC. And while everybody has unique opinions, in the end, they're all trying to make us better. So about 4 years ago, Chris Payne proposed his own subtyping system, and he did it in a very provocative way because he basically said, we should treat IC patients like cancer patients. And in my brain, I'm going, oh my God, why would you say cancer? That's going to scare people. And his answer to that is, no. You don't understand what I'm saying. He says, listen, when somebody is diagnosed with cancer, they're given a very clear diagnosis that you've got cancer of the left breast that is estrogen dependent type 1, 2, 3. And with that diagnosis, you are given a very obvious, clear treatment pathway. And he says, the problem with the diagnosis of IC is that you and your doctor really don't know what the hell to do next. There is no intuitive pathway, right? And normally IC patients, doctors who don't go to the conferences, the local urologists, they're treating you out of a textbook. They're going to give you Elmeron. They're going to give you an antihistamine or an antidepressant with the diet and send you on your way. But we know that doesn't work for a lot of people. So Chris says, to give you an intuitive pathway, we need a more specific diagnosis. And so how do we get that? With subtyping. So this is his name, Chris Payne, the 5 subtypes of IC. So in his system, this is it, and he now just know that when he created this, one of the points that he made 2 critical points. Point number 1 is it's very unfair to tell patients that it's incurable because we can cure some of these subtypes. And number 2, there are probably many more subtypes than we know now. But let's look at his preliminary 5 subtypes, and I agree with him 100%. So IC subtype 1, Hunner's lesions. Everybody in the world agrees this is a unique group of patients. Everybody, every clinician, every doctor in the world agrees that this is unique, to the point that we are arguing that these patients, Hunner's lesion patients, should have their own patient association. They should have their own research, and they should have their own treatments, because to lump them in with anybody else is kind of unfair. So these are the patients who have bloody bladder walls, bladders covered with lesions. Okay, and I have a picture. Let's see. So let's look at a picture of lesions. So these are pictures from a research study. And this is the best one to look at because almost every lesion has a center point, and then it has arms of inflammation going away from the center point. So you can see that this is a small lesion. You see that lesion. So, right. Okay. Look, that's a really good one. Lesions are characterized by what we call a waterfall effect, that when you stretch them, they bleed profusely. So lesion patients tend to have a lot of blood in their urine. So what causes a lesion? Well, isn't that one of the interesting mysteries? What we know is that lesion patients don't get better on Elmeron and most of the oral treatments. So the question is why? And what we do know is that when a lesion is treated correctly, when you cauterize that lesion, when you inject a steroid into that lesion, when you use Lyris, or when you use hyperbaric oxygen therapy, lesions improve dramatically. So what causes lesions? Well, we had a couple of research studies recently that have connected have connected lesions to viruses. That a lesion may be a viral infection in some of you. And last year at the American Urology Association, we had a research study that linked Epstein-Barr mononucleosis to Hunner's lesions. We also know polyoma BK has been linked to Hunner's lesions. We know that patients with herpes often get worse when they have a herpes outbreak. Remember, a lot of us, when you think bladder infection, you're thinking bacteria. None of us really thought viruses, but lesions may be viruses, viral infections. All right. And there may be something else causing that we don't know. But the viral research continues to be very productive. We call it the virome. Researchers are now trying to understand the role of viruses in the bladder, if they're supposed to be in there, and all that sort of stuff. This is really cutting edge, basic bladder studies right now. But at least we get it, and now we have therapies that work for lesions much better than Elmeron. Okay, IC subtype 2, bladder wall driven. So these are the patients whose symptoms are coming absolutely from the bladder wall. They have pain as their bladder fills with urine that is relieved by urination. So the fuller you get, the worse you feel. As soon as you pee, you feel better. This is a picture of bladder wall injury. Okay, so look at how different these are. These are massively different, right? So there's lesions, that's bladder wall injury. They're not the same. Oops. And when we ask you the question, when is your pain the worst? Before you pee, after you're done peeing? If your pain gets worse as your bladder fills with urine, think about it. Urine is getting higher and higher and higher and higher and higher. It's entering these wounds. It's causing irritation. And then as soon as you pee, bam, urine is off of the wounds and you feel better. So the question is how the hell does this happen? How could this happen? Well, the bladder, like any other part of the body, can be hurt. It can be hurt. And it's usually hurt through chemical exposure. So this, for example, would be very consistent in somebody who's gone through chemotherapy, chemo-induced cystitis. Okay, and Seawidows, hon, we're going to come back to that. Okay, so the chemicals in chemo are some chemo are very, very caustic and aggressive, and they irritate the bladder wall badly. But you see the same effect in people who drink a lot of diet soda. If you're one of those people where you don't drink water, you just drink soda and coffee, your bladder is going to look like that. You got to remember, your bladder was designed for life 5, 10, 15, 20, 50, 100,000 years ago or more. They didn't have coffee and soda when your bladder was designed. And so if you're consuming a lot of acids, a lot of extra irritants, at some point in time, you're going to exceed your bladder's ability to defend itself. And it could happen when you're 15 and it can happen when you're 80, but it happens. What else can trigger this? Estrogen atrophy. Because if you remember, your bladder is like your mouth. It is a hollow organ covered with mucus. Unfortunately, that nice thick mucosal barrier is estrogen dependent. So when you're young and you have lots of estrogen, you have a lot of mucus, so you can get away with the acids. But when you're older and you have much less estrogen, you have much less mucus, and all of a sudden, those coffees and sodas hurt because your bladder can't defend itself because it doesn't have enough estrogen to produce mucus. Okay. Also, in this subtype is the potential for chronic infection. We now know from the MAP Research Network, funded by the National Institutes of Health, that many patients with flares have fungal infections. And guess what? Urine cultures don't test for fungus. And the worst thing is that when you call and tell your doctor you have frequency urgency, they give you antibiotics, or you self-medicate with antibiotics, having no clue you're making it worse because you actually don't have a bacterial infection. Some of you might have fungal infections. So how do you find out if you have a fungal infection? You do next generation urine testing. That will tell you, or you can just pee and they can look at it under a microscope. I mean, the best way to diagnose yeast vaginally, the easiest way to do it, normally what they do is they don't send it out for a test at all. They just take a vaginal swab, put it on a slide, look at it, you see the yeast growing. Technically, you could potentially do that same thing. Doctors don't normally look at urine under a microscope. But next generation urine testing would not only tell you if you've got a bladder fungal infection, it would also tell you if you potentially have a weird, unusual chronic infection. Interpreting these results is challenging. Not every doctor supports us because they don't know how to interpret the results. But to me, it is an important piece of this puzzle. It is hard data. And I showed my last next-gen results in about an hour ago in this lecture because we're going on almost 4 hours right now talking. So what are we going to do for this subtype? We're going to be doing things that are calming and soothing to the bladder wall. We're going to be trying to create an environment that will support healing. And that's where our patients make a mistake, because some of you are saying, I'm not going to let IC rob me of my coffee or of my soda, and you keep drinking it anyway. And I double dog dare you to, instead of thinking of IC as a disease, I want you to think of it as an injury. That if you had a open wound on your hand, seriously, if your hand looked like this, are you going to pour acid on it? You going to put coffee on that open wound? Green tea, black tea, soda, lemonade, limeade? Of course not. Of course not. Because your job is to try to help that wound heal. This is about creating an environment that will support healing. And that is why diet modification matters. If you drink one acid a day, strong acid a day, whether it's a cup of coffee or a soda, your bladder will never be able to repair itself, because that one acid a day is destroying those new fragile cells that are trying to repair your bladder. And that's from a National Institutes of Health lecture I attended years ago. All right. Also in this subtype, I think there's a hormone subtype in here. Because there's certainly a group of patients who are very hormone sensitive from puberty. And when their hormones finally get corrected, their symptoms go away. And yet there's no consistency here. For some people, like I was working with, or got an email from a lady last week or the week before where her estrogen levels were over the top high. It's like, holy moly, how did they get that high? Like normal is 150, and her estrogen level was like 750. And then her progesterone was slim to none. It wasn't active at all. And so could that overabundance of estrogen be triggering issues? Yeah. And then we've seen the opposite. We've seen patients with not enough estrogen. So that's another subtype that needs a lot more work. Okay. So that's IC subtype 2. IC subtype 3 is the bigger subtype. So this is a subtype of patients whose symptoms began after a muscle injury, a car accident, a fall, having a baby, surgery, a rape, a history of athletics, where if you were an ice skater or a gymnast or a dancer or a football player or a wrestler, your pelvic floor muscles are the only muscle group in the human body involved with major bodily functions because, so here's your pelvic floor. You've got muscles that go from left to right. You've got muscles that go from front to back, and you've got muscles that go from low to high, right? It's a lovely woven basket of muscles. And at the base of this muscle are 3 holes for women, one for your urethra, one for your vagina, and one for your rectum. For men, they have 2, right? So if these muscles are injured, what do? They get weak. When they're weak, because they can't do the job they're supposed to do, they get tight. And instead of being long and loose and pliant, what happens is they go, right? So you got tight pelvic floor muscles down here. So if you have sciatica, you get that pain shooting down your leg every now and then. That's a tight pelvic floor muscle. That's a tight piriformis muscle. If you feel like you're carrying a bowling ball around, if you have a downward sensation or an upward sensation, after my hysterectomy, it felt like there was a fist in my vagina pulling downwards. And it turned out that was my levator ani muscle. I mean, it's so interesting now. So think about it. You got muscles going like that. So here's your bladder. Here's your muscle. It's going like that. Your tight muscles are restricting blood flow to your bladder. It's very hard for your bladder to be healthy if it has diminished blood flow, because that means it's not getting good oxygen and it's not getting good nutrition. So our therapeutic for this, and of course, the sad thing here with this patient is you have really no clue you have a muscle injury. Your first symptom is frequency, urgency. You call the doctor, they say infection, they give you on antibiotics, it doesn't fix it. You call the doctor, he goes overactive bladder, you use overactive bladder medications for weeks or months, that doesn't fix it. You go back to the doctor says, I see, throws Elmeron at you, that doesn't fix it, and you're sitting here struggling with pain. And the reality is for this patient, none of those bladder medications are going to work at all, because bladder medications will not loosen a muscle. What will loosen a muscle is a muscle relaxant and physical therapy. So, and of course, the challenge here is that because these muscles are inside of your body, the only way that they can assess it is by getting inside of their body, which means it's a finger up, you know where. It's going to be a finger in your vagina or a finger in your rectum. And the muscles are interesting. Your finger is a good example because look, you've got knuckles, right? And it turns out your pelvic floor has layers. So you're going to have shallow muscles down by your urethra. You're going to have mid-level muscles and you're going to have deep muscles. So when you go and have a pelvic floor assessment, they're going to do shallow first, and then they're going to go deeper, and they're going to go deeper, and they're just touching muscle groups. If you can go to the physical therapist, and if they can touch something which triggers your pain, hallelujah, baby, they found it. They found it. That is a tremendous success. Now, some patients get scared. It's like, ow, that hurt, and you don't go back. And then you go back to bladder medicine, and bladder medicine won't work. If they can trigger it by touching a muscle, that is de facto proof that you have a muscle that's driving this symptom, and you got to educate yourself about how muscles work, and you've got to do muscle therapy. And this is a really good example. So what they try to do, so your muscles are locked down, right? So they're going to use their finger and they're going to very gently just try to, I mean, this isn't the perfect example, but it kind of shows you what they try to do. So they're going to use their finger and just slowly try to rub that muscle, right? And they're just trying to get that muscle to lengthen to its normal length. So when you have physical therapy, you're going to feel this sensation. You're also going to feel, if they're working on your levator muscles and some muscles, you might even feel that sensation that you feel when you need to have a bowel movement. And it's not, you're not going to have a bowel movement. It just means they're touching that muscle. So they tend to go long and lean, but they also tend to go like this. and they're just going to try to find the muscle that's dysfunctional to help you. Okay, so that's IC subtype 3, the largest subtype. IC subtype 4 is pudendal neuralgia. So these are the patients, they don't have a bladder injury, they don't have a muscle injury, they have a nerve injury. And your symptoms are positional in nature. You're fine when you stand, but when you sit down, it hurts. When you bend over, it hurts. You get that electrical zinging pain. You get pain shooting down your leg, or you have that painful arousal sensation. That means that a nerve is being compromised. These patients would never respond to Elmeron. And usually what we see in this group of patients is that it's going to be tight muscles. So we're going to do pelvic floor muscle therapy. And hey, listen, we just had a couple of people come into YouTube. So guys, this is a real support group meeting for people who are in agonizing pain. And so we need you to take this really seriously. Please don't make any jokes here. I've got people in this room right now crying and they need help. Okay, so this is not a fun thing. This is a serious thing. All right. Our last subtype is going to be central sensitization. This is the inherited subtype. So these are the patients whose symptoms often begin in childhood. And so what that means is that the nerves throughout their body have become sensitive. They have a lower nerve threshold. So they're going to have very sensitive skin. They're going to be drug sensitive. They can't take normal medications. Hey, dude, seriously, this is a support group meeting for people who are in agonizing pain right now. I mean, you can't make fun of it, okay? This is not what that is. And I need you to respect the fact that there are people in this room right now who are struggling, who are crying, and you need hope and support. And so I really need you all to chill out and leave. If you had a family member who was in agony and they were in this meeting, it would be real sad, right? Hold on one sec, guys. All right. Always hard when we've got people who don't take this seriously. We'll hope. Okay, so with central sensitization, what we're going to do, so this is what we know. Our body, this is the way we're born. This is an active inheritance for many of us. So we have a sensitive stomach, we have a sensitive bladder, we have a sensitive gut, we have sensitive skin. We're just sensitive everywhere. So our therapeutic priority is going to be to calm and soothe our sensitivities. Now, one of the things that really shows that we're sensitive is that we have a very wicked sense of smell. Of a very, very wicked sense of smell. So if you can smell things that other people can't smell, then that means you've got an amazingly good nervous system. Being sensitive is a gift. Man, the best career for somebody who's sensitive is making perfume, right? The people who are sensitive are the people who are going to smell the fires and save lives. It's not bad being sensitive, but in today's really aggressive lifestyle, it's hard. It's really, really hard because we have a lot of things in our daily life that trigger those sensitivities. The odds are you've already figured that you are better in the country rather than the city. Most people are. And you're probably going to be happier in a quieter job. Your body isn't necessarily designed to be a trial attorney or a surgeon. Your body's designed maybe to be a writer or an artist or just something a little bit quieter because that's the way we're wired. We tend to be noise sensitive. Sounds can bother some people. Smells can bother some people. Chemicals certainly bother most of us. So when you got central sensitization, again, we don't look at that as a disease. And what we know is we've got to try to calm all the nerves down. So if you've got a sensitive stomach, or if you've got a sensitive bladder and vulvodynia and irritable bowel, we're going to work on all those at the same time. Because if we leave one uncontrolled, so let's say you got your bladder under control, you got your bowel under control, but your vulvodynia is screaming, that those nerves are just amping up all the other nerves. So our goal is to address all the nerves. Now, central sensitization can also happen after injury or trauma. So it's very, very interesting the way that is. So those are the core subtypes. Kim says she's been doing pelvic floor therapy for 6 weeks so far. Doesn't seem any different. Girl, you got to keep at it. You could have had dysfunctional pelvic floor muscles for 40 years. 6 weeks isn't going to cut it. You're going to be, if they found tight muscles, you have to understand that it's playing a role in your symptoms. No doubt about it. So you got to keep at it. But remember, the most important part of physical therapy isn't the physical therapy appointment. It's you doing your homework when you get home, doing the stretches and all that other stuff that they tell you to do. And you might even need to use a glass wand. Like this is an example of a glass wand that you can use on trigger points. And the physical therapist will teach you how to do that. Kim says, do you take Elmeron? If so, has your eyesight been affected by it? I've never taken Elmeron. I was diagnosed before Elmeron was approved, and when it came out, I'm a pharmacologist anyway, so I have a degree in drug development. There was something about Elmeron that really never made sense to me, and so I've never taken it. But we have a research study with Elmeron and retinal damage on our website. More than 1,000 patients have participated, and we're seeing in our study a 53% of those patients are reporting eye and retina damage. The studies at Emory Eye Center have now progressed to a national study with retinal specialists across the country, and they continue to produce more research, and we have more and more patients calling saying they've been diagnosed with the pigmentary maculopathy. April says you can't afford physical therapy for PFD. Okay, so what you do then is instead of going every week, save your money and go once a quarter or twice a year. But if you can go and have the evaluation so you know what the muscle is, you can and then they give you your exercises combined with what you learn in books like this. You can do it on your own. You just can't start on your own. You need a doctor, you need a physical therapist to at least identify the muscle group that's the problem first. And once you know the name of the muscle group, then you can go to YouTube. Lots of physical therapists have excellent videos on YouTube. We've got great books so that you can do it at home. And then 6 months later, go back to the physical therapist, have another assessment, and let's see if you've made progress. You're not alone, hon. A lot of people are like that. My physical therapy that I was just doing was 125 a session for my piriformis issue. And so it adds up. So I had to stop it. But you can deduct it also on your taxes. Tammy says, my bladder removal happened because my bladder was the size of a walnut. That's exactly when it's appropriate. And I really hope you're doing better, Tammy. Kim, we've changed the way we do hydrodistensions now. They're low pressure, short duration, so they're not as traumatic. And so their ability to trigger flares are much lower now. Oh no, her urologist retired, and then he died in a plane accident. Oh my God, that's so sad. Dominica says, just got a suppository of Valium. I haven't used it yet as I'm hesitant with all things medication. Do you know of any side effects you're aware of? You know, I mean, normally when you take suppositories like that, they tend to stay in that tissue. Their ability to get a lot of medication into your bloodstream to develop other reactions is much lower than taking oral medications. But you know, Valium is Valium. It could make you sedated. And so I certainly wouldn't do it before work. I mean, I would do it at nighttime or during the day. You could even potentially cut it in half. Talk to your pharmacist first to make sure you're allowed to do that with the formulation they gave you, because some you cannot necessarily cut in half. I wouldn't be afraid of it because it's very successful. Vaginal Valium is very good at breaking up pelvic floor spasms. and pelvic floor tension. Kim says you're going to see a urologist this week. You're going to ask her about subtypes. Kim, I'm going to tell you, I'm going to bet you right now 90 to 1 that your urologist isn't going to know about the subtypes because it's very new, very cutting edge. The only people who really know about the subtypes are the really top national doctors. So rather than using the word subtype, or if she's got a blank look on her head, just break it out into the system instead. Number 1, do I have Hunter's lesions? Number 2, what's the health of my bladder wall? Number 3, what's the health of my pelvic floor? Number 4, do I have any nerve symptoms? And number 5, central sensitization. The word subtype might throw her off. Also, some doctors call it phenotyping. But this is very cutting edge. The top 1% of urologists in the world are probably doing subtyping at this point in time. Remember, when you come to our support group meetings, you're getting very cutting edge information because it's my job. I sat on the U.S. Army IC research panel, and so I read those studies. So you're going to hear a lot from me that you would probably never hear from your doctor because your doctor doesn't go to the conferences and they don't have time to read the journal articles like we do. Mast cell people can have mast cell issues with their bladder. There's no doubt about that. Samantha says, on the topic of low estrogen causing bladder damage, do you know if there's a link between bladder damage and PCOS? Well, the bladder damage, okay, so we have to correct your language here for a moment. Low estrogen does not cause physical damage to the bladder. It just restricts and it reduces the production of mucus. Low estrogen does not physically damage the bladder. It just makes the bladder more vulnerable to irritation. And so the question is there a link between bladder damage and PCOS, or is there a link? And the answer is yes. Quite a few patients have polycystic ovarian syndrome. I was one of them. We don't understand that connection. That is that weird hormone variant. But I used to throw a lot of ovarian cysts, let me tell you. But again, damage isn't the right word to use. Vulnerable is the right word to use here. Tanya, here you go. Here you go. This is so interesting. Tanya says, my daughter had horrible IC. Once she had a baby, her IC went away and never came back, and she drinks coffee all day. So Tanya, I mean, two things come to mind with that. Number one, was she a weird hormone subtype, and did her hormones stabilize during the pregnancy? And which is certainly a possibility, but also pelvic floor. I mean, it could have been a pre-existing pelvic floor issue that somehow got affected and improved with the pregnancy. Tanya says, my IC started after having 3 babies via C-section. They cut you vertically and did something to move your bladder out of the way. Hon, the absolute worst vaginal incision, the worst incisions to have are vertical incisions. Up and down incisions. Those are the ones that are much more traumatic to everything down there. I'm so sorry that you had to go through that. And so the odds are now we know you've got some muscle trauma. We know you probably also have some adhesions too. You may even have some scar tissue adhesions with those scars. Dominica says she gets the pulling down sensation like I did. Kim says, I never had kids, developed IC when you were mid-20s. I'm now 52. I never had kids either, Kim. I wanted to. It just, unfortunately, it breaks my heart that didn't happen. Kim says, you tried to stop the Elmeron damage because of the retina damage. You tried to stop Elmeron because of the retinal damage, and it threw your body out of whack. So Kim, what most patients do. So we asked. Well, we didn't ask. We have a lecture series on our website, and Dr. Parsons, the guy who invented Elmeron, appeared in it. And one of our members said, "Well, I have to take Elmeron the rest of my life." And he said, "No, absolutely not. What we have to figure out is if it's helping you." So the patient asked, well, how do we do that? And he goes, you gradually reduce the dose. So if you take 4 Elmeron a day, he said, go to 3 a day for a week and see what happens to your symptoms. If your symptoms get worse, that means it's helping you. If your symptoms don't get worse, go down to 2 a day for a week. If your symptoms don't get worse, go down to 1, and so forth, right? So it's always gradual. It's never sudden. You always want to be gradual. But because Elmeron has gotten so expensive, most patients simply cannot afford it if they don't have insurance. So instead, what they do is a 1-to-1 swap. So if you take 3 Elmeron a day, what you could do is 2 Elmeron and 1 bladder rest, because bladder rest contains chondroitin and hyaluronate. Bladder rest is our alternative to Cysto Protect, which has a cancer warning on it now, so we're not promoting Cysto Protect. So this is our next go-to. So what would be interesting would be to go to 2 a day Elmeron with 1 a day bladder rest and do the same thing. Do your symptoms get better? Do your symptoms get worse? If your symptoms don't get worse, then you could go to 1 Elmeron, 2 Cysto Protect. 2 bladder rests a day. So it's that 1-to-1 swap that has been recommended by the doctors now for years. And that's what the doctor who invented Cysto Protect was appearing at the 2006 San Diego IC Patient Conference. They were both on the stage talking about this, and that's what they said, 1-to-1 swap. Ileana Brockman is in the room, guys. We've got a celebrity in the room. Ileana Brockman has been working with IC as long as I have, for sure. And she is the one who invented these last wands. She says, men have stronger muscles, which means they need to be more vigilant about taking care of their pelvic floor. Ileana, did I tell you I was working with a Denver Bronco football player? And holy hell, was his pelvic floor a mess. Ooh, it was terrible. So guys, Ileana owns this company, IC Relief. And they do glass wands. They have a straight glass wand or this curved glass wand and an extra large glass wand. So if you've got painful trigger points and you need to work them without your physical therapist can show you how to use this. It's what I do. If I need to do it. It's weird, but you know what? You do it. The nice thing about these packages is you also get free samples of Relivium and of aloe gel, or you can use KY, something like that, to insert it. So again, after my hysterectomy with my levator spasms, that was my go-to. And I'm telling you, it's the only thing that stopped it. What are we doing on now, man? We are at 4 hours. Yeah. So Kim says, you have no homework. They haven't given me any sense. Your muscles are so tight. So Kim, what are you going to do? Number one, you got to start practicing relaxation. Your muscles are tight. So there are tools like progressive relaxation that will, and in fact, some of them are free. Let's see here. Where are my CDs? Here they are. Woohoo! All right. So you can get Beaumont Health in Michigan, are the top IC research center in the country, produced a series of guided relaxation CDs, guided imagery to enhance healing. And this is for pelvic pain, IC or vulvodynia, guided imagery for relaxation for women with pelvic pain and IC. And then they also have one for men, guided imagery to enhance healing for men with chronic pelvic pain and prostatitis. So relaxation starts from the outside in, girl. And so taking hot showers, hot baths, gently stretching, and eventually you'll get to the internal work. But right now your muscles are hard for a reason, and you've got to take back control over those muscles. That's what, what happens over time is we just kind of get very passive about our muscles. And ultimately in the end, we have to take control of them. Oh, Ileana says Amy Stein has written a free internal pelvic floor self-help guide. Look it up on Google. Your physical therapist can show you how to use it. Ooh, thank you for sharing that. I didn't know that. Kim says, sad the Mayo Clinic doesn't treat IC. We would never send you to Mayo. They have historically been terrible at IC for years. Decades. Ileana, I don't know if you ever sent anybody to Mayo, but we never did. The horror stories of patients going to Mayo were substantial. Kim says, is Elmeron thought to be a mast cell stabilizer? Not as its primary effect. It might be a beneficial side effect, but you've got hydroxyzines, which would do the same thing. Marina says, hey, you're brand new to this. You read the other day that there could be bacteria which are not tested for. Can you please expand on this? Marina, we have talked about that extensively today, and I have videos on our website, but our last live meeting, we talked about it extensively also, and it is the feature story in our latest magazine of the IC Optimist, is IC the result of infection? And I'll give it to you very, very quickly. You can't put all your eggs in the infection basket because we now have subtyping, and we now know that quite a few IC patients have muscle issues, as well as inherited issues, as well as nerve issues. However, bacteria infection has been implicated in a small group of patients. Hunner's lesions have now been connected to some viral infections. Polyoma BK, Epstein-Barr, maybe at the root of some Hunner's lesions. We know through our own National Institutes of Health MAP Research Network studies that IC patients having flares may have overgrowth of candida fungal infections. And yes, there may be, I have no doubt that there is a small group of patients who have a chronic bacterial infection that typical urine testing cannot find. And that really is the big debate right now. And as Ileana can say, since we were both back involved in the 1990s, infection was the hot button back then. There were really big aggressive groups who thought that IC was all triggered by infection. They were led by Dr. Paul Fugazato, who ran the Cystitis Research Center in South Dakota. He believed that IC was the result of fastidious infection. Unfortunately, his research methods were prone to false positives. Then they found Lyme disease in some bacteria. So a lot of patients had tests for Lyme disease. But most patients are negative for Lyme, but Lyme is possible in some. Virus is possible in some too. But again, you just can't put all your eggs in the infection basket. Watch our video on the 5 subtypes of IC first. And if you just feel deep in your heart that infection is playing a role, then go ahead and have a next generation urine test. That'll prove it once and for all. Where's my slide on this? If you're wondering, you can have a next generation urine test. Just go to bladderhealth.org. You can watch videos of doctors using it. And this is how they find the hard infections. This is how they find the weird infections. This will also tell us if you've got a fungal infection, and that's important too. The challenge with this type of testing is that it will show you all the good bacteria and all the bad bacteria. So interpreting the results is very challenging. Okay, we've talked about this extensively in other things. Tanya says, can we take turmeric for inflammation? If you don't flare from it, sure. But some people flare from it. Haggis says, the last time I saw my urologist, he said, you know much more about IC than I do. And I replied, well, Jill is the one teaching me all of this. And I showed him the IC Network Facebook page. He was amazed. I hope he will watch some of your videos too, so he can learn more himself. Oh, that's very sweet. Ravonda says, my doctor recommends radiofrequency ablation for pudendal neuralgia. Pudendal block is successful. I have done years of women's health physical therapy. Any thoughts? Hun, I don't have any experience with that, I'm sorry to say. Yeah, Eliana says she had patients in the United Kingdom in the last 10 years who were given major doses of antibiotics and they did not improve. And so the odds are for those patients, they were pelvic floor driven or something else. But we also have to be respectful or not consider the fact that there certainly is a small group of patients who take antibiotics and feel better. And the question is why? Is it because of the anti-inflammatory effect of the antibiotic, or is it because they had a difficult to find bacterial infection? And that's the whole point of Dr. James Malone Lee in a lot of his discussions on Twitter right now. Is he says is that typical urine cultures are just ineffective. That they don't they won't grow out the vast majority of bacteria that can be present. But he also says next generation tests aren't necessarily useful because even if you have a list of all the bacteria, you have no idea which bacteria is the problem, which I can see his point. But it's still hard facts for me. I like facts, so I like seeing test results like that. And ultimately, what he does is he looks at urine under a microscope. And if he sees white blood cells, if he sees pus, he says this patient has an infection. And then they treat it with a very narrow focused antibiotic for a long period of time. And I tweeted to him and I said, but wouldn't you agree that the value of next gen testing is that it gives you at least the antibiotic sensitivity testing? And he said, yeah. He said, that's true. So we're back to kind of that old debate with new people, and it's very, very interesting. Rebecca, I'm so glad you're able to catch me. Awesome. All right, my fans, listen, I've been standing here for a long time. It's almost 5 o'clock. I have had literally all day 3 bites of one piece of toast. I need to stop before I make a fool of myself. So it's time to say goodbye. I'm going to wish you well, everyone. We will be doing a drop-in again meeting sometime this week or next week. Our live scheduled meetings are the first and third Sunday of every month, starting at 12:30 Pacific time, 3:30 Eastern time. If you have any questions, you are always welcome to call the IC Network, 1-800-928-7496. Most of all, please come to our website, icnetwork.org. Make sure that you come over to Facebook if you can. If you would please subscribe or like our Facebook page or subscribe to subscribe to you. Okay, see, I'm getting tired. Like both of our pages, please, because that's how you will get notified when the live events happen. And last but not least, this has been free. The IC Network, 95% of everything the IC Network does is free. But if you do find this helpful, it would be very helpful if you became a member of the IC Network for $25 a year, because you would then get this wonderful magazine as well as a bunch of other stuff. And that's really what keeps our support services going. We do have to have a little bit of income. When you're buying stuff, please don't go to Amazon. Please buy it from our store. You know what? It's cheaper. It's cheaper. Everything that gets sold on Amazon, you add extra $10 because that's their cut. So if you want the Peora or the Bladder Builder or the Bladder Rest, come to our website and it'll be much, much cheaper. All right. Okay, my friends. I will see you later. Sleep well tonight. Have a wonderful week this week. All righty. Goodbye, YouTube. I'll see you later.